to get started? Okay, welcome everyone to our 4th annual Diabetes Awareness Seminar for today, November 11th, 2023. We are Stonebridge Healthy Community Outreach Initiative, and I am Millicent Walker, the Executive Director and your MC for this morning. Stonebridge Healthy Community was organized by Ollie D. Smith, a retired school teacher, in memory of her parents, Penny and Willie Smith, who were the proud parents of 12 children. In 1963, Miss Ollie's father passed away at the age of 54 due to complications with diabetes. Miss Ollie was diagnosed with diabetes along with actually all of her 11 siblings, 3 of which are now deceased. By aggressively changing her diet and developing a regimen of taking vitamin supplements and incorporating exercise in her daily routine, Miss Ollie was able to successfully manage her illness, rendering her a better quality of life. Due to her success, Miss Ollie became passionate about teaching and helping others diagnosed with diabetes or at risk change their habits to develop healthier lifestyles. Who is Stonebridge Healthy Community Outreach Initiative? Well, our mission is to bring awareness, prevention, and restoration of lifelong health solutions for diabetes and other chronic conditions to families and communities. Our overarching goal is to educate individuals by providing quality information and services that address individual needs in order to manage, prevent, and/or reverse chronic conditions. Our primary objective is to help participants modify their lifestyles through educational resources such as plant-based nutrition, economic stability, physical activity, spiritual wellness, social connectedness, mental health, and creativity. Why are we so interested in offering these things? To help bridge the gap between education and health disparities, as well as to provide access to healthcare and affordable quality food. To empower communities by providing them with the tools that will aid them in making the best lifelong decisions and prevent the development or worsening of chronic conditions. To teach individuals the dynamics of meal preparation as part of their life skills and self-management training. We also want to creatively inspire children to make healthier food choices during their developmental stages, and to help people heal from their chronic diseases by providing them with resources, compassion, and hope. Today, our first presenter is Dr. Ansel T. Johnson. Dr. Johnson is founder and clinical director of Vision Salon Eye Care Center Associates in Blue Island, Illinois. He received his doctorate degree from the New England College of Optometry in Boston, Massachusetts. He completed a postgraduate certificate from the Optometry Executive Program at the Wharton School of Business at the University of Pennsylvania. He is a currently adjunct professor at 4 Doctor of Optometry programs. He also currently serves on staff at Advocate Trinity Hospital in Chicago. Dr. Johnson's office is the first and only in the state of Illinois to incorporate a nationally certified diabetes self-management program within an eye care facility. He is a certified lifestyle coach for the CDC Diabetes Prevention Program. He has been a member of the Association of Diabetes Care and Education Specialists for over 20 years. Dr. Johnson is a national thought leader in eye care, concentrating in diabetes eye care, new technologies, and glaucoma management. He is a national industry speaker. In June 2020, Dr. Johnson founded and serves as CEO of the Healthy Living with a Vision Foundation. The 501c3 foundation has a mission to eliminate the health and wellness disparities in communities of color. His professional leadership has been shown by various leadership positions in many organizations currently and over the years. Twice listed in Black Enterprise magazine as one of America's top 101 African American doctors, he was honored in a White House ceremony during the Clinton administration as a Head Start success story. Dr. Johnson is a proud member of Phi Beta Sigma Fraternity Incorporated. Dr. Johnson continually works to positively impact eye care and healthcare in the community. And with that, Dr. Johnson, I'll let you take it away. Thank you.
I have been around for a while in the South suburbs, over 30 years. So there's a lot of alignment that we have that our not-for-profit Healthy Living with a Vision and Stonebridge have. I'm very passionate about diabetes because, as with your founder's situation, we have it very prevalent in my own family. And I am a walking, talking example of someone that is living with type 2 diabetes now. Because I was a knucklehead. I had knucklehead syndrome. You know, you're taught, oh, you're borderline diabetic, or you're, just have, and it wasn't taken seriously. And, the mindset that a lot of us fall into is that, well, at least I don't have diabetes, right? So you get so busy taking care of other people that your own care kind of gets pushed off to the side. And so lo and behold, I had a very serious health incident, and that's a ride in an ambulance to a hospital emergency room that no one wants to take. But again, if you keep ignoring those signs, and again, my message is always to present to people that if you're borderline or pre-diabetic, to take it very seriously. If you've had a child and you had gestational diabetes, your risk for developing diabetes is much more increased in your adult lifetime. So I just accepted a board position with the organization in my field. It's called the Ocular Wellness and Nutrition Society. And again, this organization is very much in alignment with what we do every day in our office, and align the eye health and eye care with your overall health, because it's all connected. It's all related. And what we do, we are science-based 501c3 also that connects evidence-based medicine, nutrition, with all the stuff that we ask people to do, we ask people to look into to connect their eyesight, their eye care with their overall health. And I do want to present this disclaimer where basically the information that I'm providing is based on my own knowledge and the research that I've done, and is intended for general informational purposes only. And so the information that we're going to give today is not to be considered as your own personalized medical advice, and is not a substitute for direct consultation with your own healthcare provider. And any medical recommendations or suggestions that we provide are of general nature and may not be applicable to every individual's specific health situation. So we want you to always consult with your own healthcare provider before making any changes to your medical care or your treatment plan. And so myself as a presenter and the organizers here do not assume any liability of any actions taken by individuals based on this information during the presentation. So reliance on this information provided in this presentation is at your own discretion and risk. So basically, folks, do your own research. I always tell people I'm not offended if people want a second opinion, because you're empowering yourself with information. There's a lot of stuff that people find on the internet, and I invite people to, let's have a conversation. Let's talk about it, because there's a lot of bad stuff, but there is some good information that you can find. And again, one thing that we do as doctors of color, there are certain social determinants of health. And I tell people, just being a person of color, just being Black is stressful. So there are a lot of things that can interfere with our own healthcare. It could be transportation, it could be finance. And guess what? A lot of times it's the insurance plan that you're on, that you have, that may limit your choices in providers. So again, we were recognized for the work that we do in terms of diabetes in our national professional journal, the American Optometric Association. So we're really passionate about that. And then let's talk about clinical care where optometry, can make a difference. And we have to remember that representation really does matter. It's been shown, documented, Black people do better with Black doctors for various reasons. Doesn't mean that European doctors or other doctors are racist or whatever in nature, but and I call it street credibility. We have a certain amount of street cred, being in a community, growing up in a community, going to church in a community. And so there's a measure of trust, the language. And so, but we also have to remember only 5% of African-American physicians in this country are African-American, and less than 2% of us that are optometrists are African-American. And the center picture is myself and my associates. Dr. Shannon on the left is full-time Dr. Johnson, the other Dr. Johnson in my office. We grew up and we trained together in undergrad, and we both trained on different parts of the coast. I went to the East Coast, he went to the West Coast. So you have 3 African-American eye doctors in one practice. So that's something that's very special. So let's talk about diabetes. So when we talk about diabetes, it's easy to get overwhelmed. You're talking about diabetes, metabolic syndrome. I mentioned that. That was my own journey in addition to being pre-diabetic, high blood sugar, hyperglycemia. You hear a lot of terms. You have diet. What should I eat? I can't eat this. I got to worry about my blood sugar. Oh, how am I going to inject this insulin? I have type 1 diabetes, so I have to use a pump. I'm thirsty all the time. I'm going to the bathroom all the time. All of these things can make the diagnosis of diabetes quite overwhelming. And there's actually a high level of depression in people that have been diagnosed with diabetes. So you have to take care of your mental health too. It can be overwhelming, but as we share with our patients, it's about baby steps. So is it really about sugar? And we get into, well, I can't have regular sugar. I can't do, I'm going to get rid of all the sugar in my diet, or can I have a little bit in my coffee, or can I have a little bit in my tea? I'm put a little bit on my food, sweets, pastries. Well, it's more about sugar than about sugar, because we don't think about the carbohydrates and other food forms that can convert to glucose that circulates through our bloodstream. So it's more than about sugar. And let's talk about a little bit about what diabetes is, because again, I'm going to try to make a very complex situation as simple as possible, because diabetes is a multifactorial disease or ailment. And basically it's how the body handles glucose, or how the body handles sugar that is converted to glucose. And that is the energy source for all of our tissues. And in this picture here, the G means glucose. That's the sugar that's in your body. So this is kind of a normal situation where the little red oval here is your blood, or your muscle, your organs, cells, and all of our tissues have to absorb sugar. That's where we get our energy from to basically do all the things and functions that our organs do, from the stomach to your muscles to your eyes to your liver, all the tissues. And so normally the eye represents insulin, and that's circulated in the bloodstream at some level all the time. The body always has some level of insulin. And what that insulin does, it acts like a key that allows the glucose, the G's, to go into our tissues and our organs. And so our body needs insulin, which is a hormone, to unlock the surface of our tissues so that they can take in the insulin. So it's almost like cracking the window so you can get a breath of fresh air and breathe. So again, it's without the insulin, the G's will build up in the bloodstream, the glucose, the sugars, and just float freely. And that's why we measure our blood sugar, right? If you're diabetic, your physician will usually give you a prescription for a blood sugar meter, and you measure your blood sugar, kind of see where those levels are. Now, the next screen kind of shows more of an abnormal situation where you have the cell or the tissue, the organ, and you have all the blood sugar, and you have a little bit of insulin, but it's not getting into the tissue where it needs to be. So that's the situation. So that there's a few different ways in which you have elevated blood sugar just flowing through your body. One is insulin resistance, where the cells, they just kind of resist the insulin. So the insulin is trying to attach and let the blood sugar in, but the cells are just, they're not feeling it, right? So they're resistant to that insulin. And so what does our body do with insulin resistance and in pre-diabetes? The body has produced more insulin because it's detecting all this blood sugar in circulating, and it's producing more insulin to overcome the cell's resistance to letting that key come in. So it's just like the key is half frozen and you can't quite open up that door. And so you bang on the door to kind of make that key work a little bit. And then another way is that not enough insulin is made. the pancreas is our organ that creates insulin, and it's just not making enough. And what happens, the pancreas can get burned out because as a pre-diabetic or borderline diabetic, it's generating so much more insulin and it's getting burned out and it's not creating enough. And then another method is that the liver releases too much sugar. So we just have so much blood sugar running through our veins where it kind of overwhelms the amount of insulin that we're making and the tissues. So hopefully in a real simple way, that kind of explains how things are working in terms of how our body kind of dysfunctions in terms of diabetes. So again, it's a lot more complex than that, but we're basically generating insulin. I mentioned the pancreas too. So I want to remind people, if you're pre-diabetic or borderline diabetic, that pancreas that generates insulin, I said it could get burned out. When you're diagnosed as being pre-diabetic, the insulin is only working at 50% capacity at that time. So that really hit home for me. After I was diagnosed, I realized, and I read that, it's like, wow. So even at pre-diabetes, you're only at 50% capacity. And usually by the time you have that diagnosis, that pancreas that generates the insulin is only working at 20% capacity. And so a little bit by the numbers, in 2050, there are other speakers here that I'm sure will talk about statistics, but by 2050, 1 in 3 Americans will be living with diabetes by 2050. And right now with our seniors, 1 in 3 of our seniors, citizens, are living with diabetes. And the thing about living with diabetes, medical technology and medical care, they can keep us living longer, but I want everyone online to really think, what's the quality of life that you want to have as you move through life? So age doesn't mean that you're afflicted and just can't do a lot of the things you want to do. Yeah, there's some certain limitations. I can't dunk a basketball like I used to, but I'll try. No, but anyway, age does not mean that we should have a limited mindset in terms of what we do and how we live with diabetes. And so every day we think about, what's our greatest fear? People hear the D word, the diabetes word. What is our greatest fear when you're living with diabetes that people think about? Well, almost 26 million people which have diabetes have some visual impairment. So diabetes is the leading cause of adult blindness in this country. And when most people are polled and asked what sense would they least like to lose, and it's generally vision. But also there are tons of chronic complications with diabetes, chronic complications. Blindness is one. Kidney disease, we see kidney dialysis centers popping up in our communities right next to fast food restaurants. And it's doing that for a reason. Why? Because in our community, we just don't know how to take care of ourselves. And so hence people have to go into kidney dialysis. Another reason people go into kidney dialysis also is hypertension, poorly controlled blood pressure. You get nerve damage, what we call peripheral neuropathy, where you might get tingling on your fingers and arms, toes, extremities, where you have damage to the nerve conduction throughout the body. And then you have amputations, higher levels of amputations happen. People lost toes and things of that nature, and foots and legs due to poor circulation. Cardiovascular disease, which basically means damage to your heart, which can lead to the blood vessels in the eyes and in other parts of the body and your organs, can lead to stroke, heart attack, and again, loss of circulation that can cause amputations and things of that nature in the body. And then again, I always like to circle back to pre-diabetes. One reason is because that's the really great opportunity to kind of turn the ship. And I talk to people extensively if they know that they're borderline. And sometimes we as doctors don't really put enough emphasis on that, because if you deal with it now, your lifestyle quality will be so much better 10, 20 years down the road. And so 1 in 5 adolescents and 1 in 4 young adults are now living with pre or borderline diabetes. And 1 in 3 adults have pre or borderline diabetes. So when you think about diabetes, or pre-diabetes, you think about, okay, wow, diabetes is what I have to worry about. But another thing that's not emphasized, if you're borderline or pre-diabetic, you're at a higher risk for stroke, And you're also at a higher risk for heart disease or heart attack. So having prediabetes is not so benign. So whenever I always talk about prediabetes because there's a whole lot more people out here that are pre-diabetic than are living with diabetes. If you don't do anything about it, the chances are you are going to, yes, convert to type 2 diabetes. So what are the main threats to sight with diabetes? One is glaucoma. Glaucoma is an eye disease where it's related to the fluid pressure in the eye, where basically you lose your peripheral or your side vision. Happens very slowly. There's no pain. The clear vision straight ahead is the last to go. I have a lot of patients with advanced glaucoma, not a lot, but I have patients with advanced glaucoma that have close to 20/20 vision, but have tunnel vision, and they have lost their ability to drive and do other things. The second threat is cataracts. So people living with diabetes can tend to develop cataracts or clouding of that lens, that camera lens that's behind the pupil of the eye, gets cloudier and hazier much more quickly. Why? What causes that? Because of fluctuations in your blood sugar level over time just causes that lens to get cloudier. Even with prediabetes, that happens. And the third, and can also be the most devastating problem with diabetes in terms of a threat to sight, is what we call diabetic retinopathy. And with diabetic retinopathy, you have bleeding, scarring, and swelling in the back of the eye that in a lot of cases, once it's an advanced stage, for the most part, it may not be reversible. You might be able to improve it a little bit, but you already will have significant visual impairments. So these are just some illustrations. This is what we look at when we're looking inside the back of the eye with that little light. You see on the left-hand side, you see just little pinpricks, almost like of little hemorrhages. That's blood that we see in the eye. And it can advance to where you see more, and then on the right-hand side, there's scarring and swelling and things of that nature. We don't want it to get to that point. There are some excellent treatments. A lot of times, when it's very serious, we will send patients to a retinal specialist where they will inject medications in the eye to help reduce the swelling. Works real well, but the idea of getting injections in the eye and repeated injections over a month, 4 to 6 weeks period, ongoing, is not a very appealing thought. So I always share with patients, we don't want you to have to get to the point where you need injections. Sometimes we just can't help it, but if you kind of help manage your diabetes, that can always be preventable. Not always, but for the most part, be preventable. And this goes along with our philosophy with Ocular Wellness and Nutrition Society in terms of how we, in our practice, look at preventing vision impairment from diabetes. So we look at it holistically. So it's not just about isolated nutrients, but a combination of nutritional supplements and overall dietary patterns. You were talking about the interaction of multiple nutrients and their combined effect on the eye health that emphasize a need for a balanced diet. And then there can be a supplementation strategy. It depends on your diet. But sometimes you just need that extra boost that supplements can help you out with. And then there's a whole preventive potential. If you don't have diabetes, if you're not borderline diabetes, but you may have a family history. So there are a lot of studies that show that the preventive potential of nutrition in your eye health, and then timely dietary interventions can either delay or reduce the severity of certain eye conditions, not just vision impairment from diabetes. Okay, so how can we help you live with your best vision? There's a category of proteins called carotenoids. And people have all heard, eat carrots and they're good for your eyes. Yes, they are, because they have some of these carotenoid pigments. And these are pigments that have been shown to increase contrast sensitivity in terms of the sharpness of things that you see, the vision sharpness, your color vision, and they act as a natural blue light filter. And they also have been shown to reduce or slow down cataract formation. So these are some foods on this particular slide that have been shown, and it shows the amounts of the lutein and zeaxanthin are the technical names of these carotenoids: kale, spinach, collard greens, corn, eggs, broccoli, green beans, green peas, turnip greens. And I always caution people about when you're looking at eggs, because you have to watch your cholesterol. And that's why, as we said, you really need to share this information with your physician or even a nutritionist to kind of help guide you. And in terms relating to different parts of the eye, that these the vitamin supplements that help, the cornea, the front surface of the eye, vitamin C is very helpful. The lutein and zeaxanthin, those carotenoids, and vitamin C help the lens to kind of help the lens stay clean and clear, because that's where cataract formation is. The vitreous, which is the jelly inside the eyeball, needs vitamin C. Now, a lot of people complain about floaters, and there's actually a new nutritional supplement that has been shown to help reduce floaters. There's no other cure, no other treatment for it. Surgical treatment is really iffy and risky, but there's finally some new evidence-based medicine out there for a nutritional supplement that can help with floaters. For the macula, where you have your sharpest vision, lutein and zeaxanthin, those carotenoids, those are real critical for that part of the eye. And then the retina, also vitamin C, vitamin E, beta carotene, and omega-3 fatty acids. And let's talk about a couple of these things. One is sources of omega-3 fatty acid and flaxseed oil. So moving towards a plant-based diet, I know some of the speakers are really very plant-based, and I'm right in alignment with that. I'm not totally plant-based, but I've moved my diet to be more towards plant-based. Flaxseed oil, so people that don't like the idea of taking fish oil supplements, it's a great source of flaxseed oil. And it contains chemicals called lignans that play an important role in cancer prevention. And also flaxseed oil is the richest vegetable source of those lignans. Again, the benefit of flaxseed oil has been shown to help cholesterol levels, heart disease, Sjogren's syndrome, which is an autoimmune disease, cancer, and constipation. A lot of these things, diabetes is caused by inflammation. It's an inflammatory process too. So it's an anti-inflammatory situation with flaxseed oil. Again, some more about omega-3s. You go to the drugstore and you see the whole shelf, 2 shelves full of fish oil supplements and omega-3s. So we're talking about fish oil supplements as a source for omega-3s. A lot of the stuff, and I have to say that you might find in some of the larger retail and big box stores, is garbage. And I'm not going to mention any particular brands here, but one thing you need to look at, any kind of fish oil supplement that you get that is a triglyceride form, and that basically is better absorbed into the body. It's not always evident on the label, but those brands that are triglyceride forms, they usually will say it. Most of the stuff that you see retail will be ester based or ester produced or purified, which is less well absorbed. So guess what? They're going to be cheaper, but you got to take more. You might have a fishy aftertaste from that, but it's, again, not as well absorbed by the body. How much should you take? Well, usually for someone that's just maintaining good shape, just want to stay healthy, keep the bodily inflammation down, you have 2 components, EPA and DHA. I'm not going to get into that in detail because this is such but maintenance about 500 to 1,000 milligrams. To be more proactive, someone that's borderline for diabetes, I might push them, or someone living with diabetes, more high intensity, 1,500 milligrams or more of combined EPA and DHA ingredients. Now, as with anything, again, you should always consult with a nutritionist or your physician. There are some adverse effects from interactions with flaxseed oil and omega-3s you should be aware of. If you're on blood thinners and certain medicines that reduce your blood sugar. So again, glipizide, glyburide, and if you're on insulin. So be sure to speak with your physician for details on that. And one of the reasons I always talk about nutrition is that our food supply is less and less nutritious. And that's from over-farming of the soil, just over the years. And we just see less and less nutrients in the same weight of food. So that's why in many cases, nutritional supplements may be indicated. So also, again, in conjunction with your primary healthcare professionals, consider an exercise plan. Sometimes that's a naughty word for some people, but this guy kind of, at least he's starting. So he's on the treadmill, sipping a Coke or tea, whatever, and reading a book on health. But the main thing is start where you start. And this guy has a little bit more flavor, exercising with style. But wherever you can fit it in, get it in. And I usually start with just walking. But the main goal is to keep a plan. To keep healthy eyes, you have to have a plan. And when I talk to my patients about they might be on diabetes or they just got diagnosed and their physician will send them to get their eyes checked, and they'll say, and I'll ask, what are your goals? What has your physician talked about? What goals for your A1C, your blood sugar levels, in terms of lifestyle, eat? And people will say, well, I'm going to eat better. I'm going to lose some weight. I'm going to exercise. And I'm saying that's not good enough. So we talk about SMART goals that are specific, measurable, attainable, realistic, and timely. So by specific, how much weight do you want to lose? What's your goal? And I usually start off with, well, do you think it's realistic to lose a pound a week? And for most people say, yeah, that's kind of realistic. Or if it's half a pound a week, so that's 2 pounds a month, that's realistic, but it's specific even more so, and it's measurable. Is it attainable? Yeah. Is it realistic? Is it time? Well, I'm just going to change to a plant-based diet and I'm going to try to go to a boot camp or something and lose 30 pounds in a month. Well, with some boot camps, you can do that, but is it sustainable too? So those are things to think about. And so why is it important to take care of yourself? Well, I'm real big on community. As a Black man, we have to take care and look out after our family first. And knowing that I can let them down if I don't take care of myself. We as Black men, we tend to grind, we keep it moving until the wheel falls off the wagon. And we have to kind of change that mindset. And it's usually because we may have good women in our lives to kind of keep us in alignment. So that's important. If you're a grandparent or a senior, you want to take care of yourselves because I don't know too many grandparents that don't want to see their grandchildren growing up healthy and thriving. And I think that's going to bring me close to the beginning, but we have a theme verse for our office. It's out of Proverbs 29:18, and where there is no vision, the people perish. And we want to give people unlimited vision in terms of their health, in terms of how they move through space, in terms of how they live your life. And we think your vision should be without limits, not just reading the eye chart, but how you move through life, enjoy life, and how you engage with one another throughout your life. And with that, I think my time is ending. And I always say, be well, see well, be blessed. And I don't know if there's going to be a period of time for questions at all, but I went over a lot of stuff in a short period of time. And as with that being said, doctor, call it quits. You've done as much as any surgeon could do. Now let it go. And as we all do, no, I've got to keep going. I got to go on. I must. And then we have to go through the insurance forms. Did we get pre-approval? So that's my little joke about insurance. All right. Thank you all very much. Again, it's been a blessing and a pleasure. Just sharing some information, hopefully get some good things out of this. And we'll turn it back over to our moderator.
Thank you so much, Dr. Johnson. You definitely have applause here in Grand Prairie Library. Let me see. Okay. Thank you very much again, Dr. Johnson. Does anybody have any questions? We do have time for a few questions. If you do, please raise your hand or put them into the chat. That was a very amazing presentation. Thank you very much for highlighting all of the different questions. Mm-hmm.
At what age should children start getting vision tests?
The question is, at what age should children start getting vision tests, specifically for diabetes or just in general? In general.
In general, we see children in our office as young as 6 months old. The problem with that is there are not many eye doctors that see people or see children that young. A lot of the corporate places, they may not see a child until they're 6, 7, maybe 5 years old when they can read the eye chart. Well, that's not a problem for us. So I recommend at the very latest by 2 years old, they should have a full exam. It's required by law before you get into kindergarten that a child has to have a complete and thorough eye exam, not just a screening. And that was a good thing because a lot of problems could have been alleviated or prevented. And but yeah, no later than 2, 3 at the most. But we see kids as young as 6 months old.
Thank you. And Mr. Felton had his hand raised.
Yeah. Yes. Good morning, everyone. First of all, I want to say that the presentation of class was very interesting. To the Stonebridge health community, to the staff, to everyone online here, I really appreciate the information. And my wife signed me up for this. So I got one of them kind of wives that if you don't do what I tell you, I'm going to get you. So, she probably watching, no telling.
And she got you.
And but I appreciate you all. I love you all. And to Dr. Terry Mason, we are longtime friends. I've been knowing you for a long time, and I know you're an outstanding doctor. So thank you, Dr. Johnson. Thank you, staff, Stonebridge. I'm looking for some more presentations, classes, or so.
Okay.
That's all I'm going to say.
Thank you, Mr. Felton. We definitely do have, we will talk more about that as well. Just a little bit later, we have a few other presenters. And then, Dr. Kennedy received her medical degree at the University of Chicago, Pritzker School of Medicine, and went on to train in internal medicine and nephrology at the University of Illinois at Chicago. She has been working with associates in nephrology since 2009. Born and raised in the southern suburbs of Chicago, she is pleased to return home to practice at Advocate South Suburban Hospital in St. James Olympia Fields. As a board-certified nephrologist, Dr. Kennedy is equipped to care for needs regarding diseases of the kidney, hypertension, and electrolyte imbalances. Dr. Kennedy lives with her husband, 2 kids, and 2 Bernedoodle puppies in Chicago. In her free time, she enjoys cooking, shopping, traveling, and walks. And with that, I will turn it over to Dr. Kennedy. Thank you very much for joining us this morning. And Dr. Kennedy will be sharing her own screen.
Yes, thank you. Let me get my screen share going. Thank you for the introduction.
Thank you for joining us this morning.
And then we'll get everything started. If you guys cannot see anything, please let me know. Should be up now.
Yes.
Okay, all right. So thank you again for the introduction. I am going to speak with everyone about your kidneys. So there's going to be a lot of information. I, of course, will take questions at the end, but I hope that by the end of this, everybody will have some good working knowledge of what their kidneys are and what all they do for us. So I'm biased, but I like to call it the amazing kidney. This picture here just shows where your kidneys are located. So most of us have 2 kidneys. It is possible to be born with just one, and just one will do. They are fist-sized organs that are sitting at the lower back pelvis portion. And this system shows the 2 kidneys connected to the ureter. That's the tube that leads down to the bladder. And then the bladder leads out of the body through the urethra. And this is the way that your urine flows. So each kidney has millions of tiny filtering units, and these units are called nephrons. And these nephrons contain hundreds of miles of tubes and filters that process your blood as it passes through. With this process, waste and excess fluid is removed from your body as urine. And you can see on the picture, there's again the 2 kidneys and then the 2 large vessels that lead to the kidney, the renal artery, which sends the blood there, the renal vein, which returns the blood back to the heart. And then those brown structures are the ureter going down to the bladder. So I was talking about how amazing your kidney is. Your kidney can filter all of the blood in your body within around 2 to 3 minutes. So that is hundreds of liters of blood that your kidney is able to clean and filter within minutes. So it's very important to have good kidney function, and that good kidney function is very important to keeping everything in balance in your body. So what types of things do the kidneys remove? And, you know, as you're looking at these words, these are very familiar because a lot of the times these are the things in the labs and in your blood tests that we as kidney doctors and all physicians are looking at. So kidneys remove urea, creatinine, sodium, potassium, phosphorus, any drugs or medications that you use, and then various other waste products that might come into the body. Kidneys also regulate volume. So they remove excess fluid from your body and let that pass out through urine. Your kidneys also regulate salt or sodium in your body, which is very closely coupled to fluid. And this is going to come up in a few slides when I talk about blood pressure and the effects of salt and fluid on your body. But it's important to remember that salt or sodium and fluid are closely coupled. So kidneys regulate blood pressure. Healthy kidneys help control your blood pressure by balancing the amount of salt and fluid in your body, and also releasing the hormone renin into your blood. So I always use the example of a hose to kind of give a visual of what blood pressure can be in your body. So as you can imagine, when you turn on a hose, you see the hose plump up, right? And when you see the hose plump up, you know that water is running through. And you can turn that pressure down. You can turn the hose full throttle. The hose will plump up really well. You'll get a lot of, you get a projection of water onto your flowers, right? Or you can have the pressure be very, very low, where the water is just barely trickling out. Your body and your blood vessels function very similarly. So when you have high blood pressure, think about the blood vessels being plumped up, which can actually damage them as you're kind of stressing the walls. And then think about everything on the end of your blood vessels. So all of your organs just getting this heavy flow of pressure coming through it, through your blood volume. And that pressure, which we call high blood pressure, can cause what we call end organ damage, or it can damage every organ that's pretty much seeing that pressure: your brain, your kidneys, your heart. All right. So it's really, really important that you keep your blood pressure under control, because that high blood pressure is damaging those parts of your bodies. When I talk about sodium and water, so sodium and water, they run very closely together. When you eat salty popcorn, you get thirsty. That's not by accident. That's a physiologic response. So as you can imagine, when you put salt into your body or sodium into your body, that increases the amount of water that's going to be reabsorbed, right? So you're going to keep water because water follows salt. And that water or that fluid is going to increase the pressure. So that's kind of the quick and dirty about how salt and pressure are very, very closely related, and why we talk so importantly about lowering salt in your diet and watching your salt intake. So blood pressure classification. There is normal blood pressure, and these are some of the most recent guidelines. So normal blood pressure is considered less than 120 systolic, that's the top number, over 80 diastolic, that's the bottom number. We start to feel that blood pressure is elevated, or maybe even a little what we call pre-hypertension, when that blood pressure is ranging above 120 to 129 and less than 80 on that bottom number. And then there's two stages of actual hypertension. Stage 1, 130 to 139 over 80 to 89. Stage 2, at least 140 over at least 90. So I like to put this chart up there because sometimes I have patients come into my office and, they say, well, my blood pressure is always high, right? We're trying to talk to them about the diagnosis of high blood pressure. There's a little bit of denial, and they'll say, oh, my blood pressure's always ran like this. It's never run low. Well, that is not a good thing. And the goal should always be to lower blood pressure to what we consider normal. So I would just urge everyone to know what their blood pressure is and work really hard to get it into those goal ranges. It is doable, and having anything higher than normal blood pressure is not normal. All right, so there's a lot of things that you can do to modify your blood pressure. This list just shows some of the very popular lifestyle modifications that we recommend for patients, and also the effect that it can have on blood pressure. And these things do work. I have seen them work. So number one on this list is weight reduction. So maintaining a normal body weight and having a BMI between the normal range, which is 18.5 to 24.9, can on average decrease your systolic blood pressure by 5 to 20 millimeters of mercury. So that's a really good effect if you can keep your weight in a normal range. The DASH eating plans. This is a dietary approach to solving hypertension. That's a diet that's rich in fruits, vegetables, low-fat dairy, with reduced content of saturated and total fat. And adopting this diet itself can decrease your blood pressure by around 8 to 14 millimeters of mercury. So that's that top number again. Sodium reduction. I hope I just explained very well how sodium can impact your blood pressure. So reducing your sodium intake, 2.4 grams or 6 grams of sodium chloride a day can decrease your systolic blood pressure by about 2 to 8 millimeters of mercury. Aerobic physical activity, that which we all struggle to get in. So regular physical activity, at least 30 minutes a day, most days a week, can decrease your blood pressure by 4 to 9 millimeters of mercury. And then moderate alcohol consumption. So moderate alcohol consumption, one drink is considered half an ounce or 15 milliliters of, what I would call hard alcohol. So 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of whiskey. And limiting your alcohol consumption can decrease your systolic blood pressure by 2 to 4 millimeters of mercury on average. All right, so the kidney is not done with those things. The kidneys also help keep your body in pH balance. Through your urine, you can excrete acid. And this excretion of acid helps keep your blood in pH balance and helps keep your blood at the right acidity level. Kidneys can also help keep bones healthy. They are involved in a bit of a complicated process where they communicate with your parathyroid glands, which are little glands in your neck. And these glands in your kidney help to regulate bone turnover in your body. So when your kidneys don't function well, your bone turnover, and I describe bone turnover as, you comb your hair comes out, but a lot of times you don't notice it because, there's already new hair growing back. Your bones are doing that in your body constantly, breaking down and building up, and you don't notice it. But it's a very intricate thing that's going on between your kidneys and your glands and your hormones to keep your bones healthy and turning over at the right rate. And kidneys also help make red blood cells. Again, this is another hormonal mechanism of the kidney. They produce the hormone erythropoietin, which stimulates your bone marrow to make blood. So we can see in our patients with kidney disease, anemia, that is coming from the fact that they don't have enough of this hormone being produced by the kidney. So what is kidney disease? Simply stated, kidney disease is when your kidneys are no longer functioning properly. It can be quite serious, and it could lead to other problems throughout your body, such as heart and blood vessel problems. It can cause failure of your kidneys, and ultimately that could lead to death. But the good news is that kidney disease can be prevented, and detecting it early is the key to doing that. All right, so kidney disease is not just a one big drop in the bucket. It's split into stages. So there are actually 5 stages of what we call chronic kidney disease that are recognized based on a calculation of what percent your kidneys are functioning at. So when we do this calculation, it's normally we just do it on the computer in the office. You'll probably see it on your lab values. It's going to be described as the eGFR. And this is simply put, it's the percent that your kidneys are functioning. And we're always talking about both of your kidneys. So the first stage is slight kidney damage with really normal or even increased filtration rate. And that's with an eGFR or kidney function percent of 90 or higher. Stage 2, we consider that mild. There's a mild decrease in the kidney function, and the function is ranging between 60 to 89%. Stage 3 is considered moderate decrease in kidney function, and stage 3 has been further broken down into stage 3A and 3B. 3A with the kidney function percent ranging 45 to 59, and then 3B ranging 30 to 44. At stage 4, we start talking about severe or advanced kidney disease. This is a severe decrease in the kidney function, and they're functioning between 15 or 29%. And then stage 5 is considered end stage or kidney failure. This is when we initiate dialysis. Also, transplantation can be done at stage 5. Sometimes it can be done at stage 4 if you happen to have a living donor, what we call preemptive. But stage 5 is less than 15% kidney function. All right, so I talked a good amount about that eGFR. It's a calculation that measures your level of kidney function and then determines that stage. So I want to make sure that everybody is having their eGFR appropriately calculated. So historically, trials were showing that persons who self-identified as Black or African American had, on average, higher creatinine levels. And for decades, there was a race adjustment to the eGFR that was being used that was not working in the favor of African Americans. So I'll give you an example. If me and Sally go to the doctor, Sally would be a white female, I'm a Black female. We both have the same creatinine, 1.3. I'm just gonna make something up. When we do the calculation, 1.3 would give me 58% kidney function, and it would give Sally 45% kidney function. So as you could imagine, if my kidney function doesn't look that bad, I might not be referred to a kidney doctor. It might not really be paid that close attention to. And that would obviously lead to me having slower access to kidney care, or maybe even lack of access, which could, in the long run, lead to my kidney function failing faster than Sally's. So that was recognized. And in September of 2021, the National Kidney Foundation, American Society of Nephrology Task Force recommended adopting a race-free approach to the diagnosis of kidney disease. So this is a very important step for healthcare equity. And when you look at your labs, you can look at old labs and it might say eGFR and it'll say African American, then there's one that's just going to be blank. Everyone should be calculated based on the one that says blank. If on your labs, the lab that you're using, you're still noticing there's 2 GFR calculations, you want to only go by the one that does not include race. Most labs are taking that out now. There are still a few where you might find it. So I just want to make sure as you're looking at your labs, you're interpreting them correctly. All right, so are you at risk? Diabetes. This is the most common cause of kidney disease, and definitely in the United States. So if you have diabetes, you are at very high risk of developing kidney disease. High blood pressure, the second most common cause, and oftentimes in communities of color, high blood pressure beats out diabetes. If you have high blood pressure, you are at risk of developing kidney disease. Smoking, by way of damaging blood vessels, puts you at risk for developing kidney disease. Obesity puts you at risk for developing kidney disease. In family history of kidney disease, diabetes, or high blood pressure, especially in those first-degree relatives, puts you at risk for developing kidney disease. And then certain ethnicities, if you're African American, Native American, Asian American, Latinx, increased risk for developing kidney disease. And age over 60 also increases your risk. So what can you do if you find that, okay, I was in that list of people, which probably everybody on this phone, is in that risk. What can you do to try to avoid developing chronic kidney disease, slow the progression if you already have it? And the most important thing is to act now and be responsible and take close part in your healthcare. So you want to take responsibility for your health. You want to partner with your provider. And part of that is finding a provider that you trust and feel that you can communicate well with. So I always urge patients, if you feel like you don't have a great relationship with your provider, consider finding a new provider, because this is a very important relationship, right? This is someone who's helping you take care of you. So you have to have a good foundation to make sure that goes well and nothing's missed and nothing's overlooked or ignored. Know your numbers. So there's certain lab tests that are very important to know. to understand your risk for developing chronic kidney disease, or just to understand where your chronic kidney disease lies. So albumin to creatinine ratio, that is a urine test, which measures how much protein you have in your urine. It is not normal to have protein in the urine. And when we find that people have protein in the urine, we know that is a risk factor, an indicator of chronic kidney disease. The GFR, I was just talking about that. That's a blood test that tells us your kidney function percent. Your blood pressure, we just talked about how blood pressure can affect all the organs, including the kidneys. Your A1C. So for those of you that have diabetes, the A1C is very important to know. I won't talk about the goals, but everyone should make sure they know the goals of their A1C based on their other comorbidities. And then your cholesterol level. Again, this speaks once more to that close relationship between the kidney and cardiovascular health. Okay, so know your cholesterol levels. Protect your kidneys. So there are things that you can do to keep your kidneys safe, to keep your kidneys healthy, and to stop damage from ongoing damage. Controlling your diabetes, very important. Controlling your blood pressure, very important. Again, the number 1 and 2 reasons why people end up on dialysis in the United States is diabetes and high blood pressure. Those should be under control. Live healthy in general. A diet low in salt and fat. Regular exercise. Maintaining a healthy weight. Don't smoke. And I should add there, moderate consumption of alcohol. So all of these things are ways that you can protect your kidney. There are certain medications over the counter that you should avoid if you are someone who has kidney disease or if you're at high risk to protect your kidneys. Non-steroidal inflammatory medications. So those include Advil, Aleve, ibuprofen, Motrin, naproxen. These are very popular pain pills that you can get over the counter, but they definitely wreak havoc with the kidneys. And I've definitely seen patients who have kidney disease just from taking high doses of these medications over a long period of time. You know, you see that especially in people that were athletes in their younger times and who suffer with lots of joint pain and pain from injuries. You must be very, very careful with these medications. Kidney doctors always suggest Tylenol. And then if Tylenol does not work, you know, ask your primary doctor to please send you to a pain specialist so that the pain can be appropriately controlled. And then ask your doctor before you take any herbal supplements or herbal preparations. Historically, there have been several herbal supplements that have come out that have proven to cause big problems in patients with kidney disease. Probably the most recent one that I can think of that I bet everybody's heard of is noni juice. I remember about 5 years ago or so, noni juice was very, very popular. Everybody was drinking it. I honestly don't remember what it was supposed to do. But for persons with kidney disease, it was causing high potassium levels. And when your potassium gets high, that stops your heart. So there was a slew of patients coming into the office with high potassium, and we had to get to the bottom of why, and we're finding out that it was noni juice ingestion. So all the herbs and things over the counter are not equal, and they're not all harmless. So in particular, if you're somebody that has chronic diseases and chronic kidney disease, check those out with your physician before you take them. All right, so I've heard a lot of talk about diet, so I did want to throw in some information about the plant-based diet and chronic kidney disease. So recently, studies have found that there are likely some pretty extraordinary benefits to following a plant-based diet if you are someone who has chronic kidney disease or if you are at increased risk. So the plant-based diet is a diet mostly of whole grains, fruits, vegetables, legumes, which are beans and peas, unsalted nuts, and healthy oils. The goal of a plant-based diet is to reduce animal products such as dairy, eggs, fish, meat, poultry, reduce the intake of those. Everyone should really be avoiding processed foods. Processed foods, canned foods, your processed meat like sausages and hot dogs, all of the processed foods, as delicious as they taste, they just don't do us any good. Refined grains like white bread, white rice, sugar sweetened beverages, all of your pops and your, kind of what I like to call it, like kid juices, and then the snack foods, chips and cookies in moderation, but you definitely want to limit them as much as you can. So there's a few diets that are quite popular that you may have heard of that kind of follow this more plant-based, plant-oriented approach. They include the Mediterranean diet, the DASH diet, which is that hypertension diet, and then the MIND diet, which is a combination. So I would urge anyone who has chronic kidney disease, or really if you have heart disease, chronic kidney disease, anything, diabetes, it's really important to consult with a nutritionist and make sure that you're doing all that you can from the dietary standpoint, because food can be medicine and it can also be harmful too. So what they are finding that the plant-based diet is doing for patients with chronic kidney disease is lowering blood pressure and cholesterol, lowering that risk of heart disease, lowering the risk of developing diabetes if you don't already have it. It also is help improving the control of your diabetes if you do. And then there are some reports that feel that it might very well slow the progression of chronic kidney disease. So all in all, plant-based diet is seeming to be a very, very good thing. And we're urging patients to move towards those diets if they can. And I do want to say, we are not asking anyone to quit cold turkey. You can take it in stages. I usually tell patients maybe to start with 1 meal a day being plant-based. And then after you kind of get used to 1 meal a day, you might be able to go with, 2 meals a day, or 2 or 3 days where you can avoid the animal products. But you can start with baby steps. Every little bit counts, and every little bit can be helpful. There's other treatment options for kidney disease. This is a relatively new one, the SGLT2 inhibitors. This is a pill-based medication. The SGLT2 stands for sodium glucose cotransporter 2 inhibitors. So these are medications that were originally created to improve and control blood sugar if you were diabetic. But studies showed that they offer great cardiovascular benefit and essentially kidney protection in diabetic and non-diabetic patients with chronic kidney disease. So there's been a big push to get patients who qualify to start on these medicines because this is one of the few things that we have that's been scientifically shown to slow the progression of chronic kidney disease. So it may not be able to reverse it if you already have some, but it will lessen your likelihood to getting to that end-stage renal disease or that stage 5 where you would need dialysis. Those medicines, I've listed them below. The first name is their generic name. The second is their brand name. So Jardiance, Invokana, Farxiga, there's commercials. I know you have heard these medicines before. The caveat is that your GFR or your kidney should be functioning at 25% or higher. So if there's anyone on this screen who might think that this is a benefit, please don't hesitate to talk to your kidney doctor or even your primary care doctor about it. So if you do find yourself in the situation where you have progressed to end-stage renal disease, there are options still for treatment. The gold standard is a kidney transplant. Okay, this is the only cure that we have for end-stage renal disease, and it is surgery that's done to replace a diseased kidney with a healthy kidney from a donor. Your native kidneys are often not removed. You will just have an additional kidney placed into your body. The donors can be living or deceased. And, in Illinois, the average wait for a kidney transplant is about 5 to 7 years. So if you find yourself in that bucket, it is really important that you see transplant providers ASAP so that you can get the list and start that waiting period. There are 6 kidney transplant centers in Illinois that are considered to be in our network, and I've just listed them here just in case this information would be helpful to anybody. If you would like to be evaluated for a kidney transplant, just give them a call, let them know where your stage of kidney disease. Again, you need to be at 4 or 5 before they really start looking into this, but you can give them a call and they will evaluate you. Of course, the treatment for kidney failure that most of us are very familiar with, unfortunately, is dialysis. There's 2 different types of dialysis in the United States. There's hemodialysis and peritoneal dialysis. Hemodialysis is by far the more popular, more well-known. 88% of patients worldwide are receiving hemodialysis. In the United States, both of them can be done at home. And we found that patients that are able to do their dialysis at home have less morbidity and mortality associated with it. So if you find yourself in this bucket again, I would urge you to consider a home therapy and speak with your doctor about your potential for this. And then I just show a few diagrams that just kind of describe what dialysis is. It's cleaning your blood with an artificial kidney and returning that clean blood back into the body. So this is hemodialysis. As you can see, the patient here, there are needles in the arm that are attached to very large tubes. The blood is cleaned through the artificial kidney. Waste products are discarded, and the clean blood is returned back. Then there's also peritoneal dialysis. This is where you use your own body, a structure called the peritoneum, which is just a really large bed of blood vessels that's kind of sitting right in front of your organs. And you're using that as your artificial kidney. There's a tube that goes into your abdomen, not into the stomach where food goes, but into your abdominal cavity. And fluid is put in there. The fluid sits, it cleans your blood, and then the fluid is drained out. And again, another way that you can do dialysis at home. And that's all. I always just put this up here just for a little joke after talking about some serious things. So this is information for me. If anybody needs it, I have 3 offices, 2 in the suburbs, 1 in Chicago, and would be happy to take care of anybody if they're in need of that. So I think I'm taking questions.
Yes, if anybody has any questions for Dr. Kennedy.
Thank you. We do have one question here in the room. I'm sorry, we had a situation, in-person situation. Yes.
I know several people, Dr. Kennedy was talking about home dialysis. And in each one of these patients, and none of us knows each individual patient's history. But from what she's saying, that would be a good route to go. But the people were on where they went out for the dialysis. And then when they started doing the home dialysis, they seem to get worse for some reason. So I don't know, but that kind of shocked me when she said that, because that has not been my experience. And I'm trying to figure out, is she saying on the whole that that's a good way to go, or what?
I think the question is, are you saying that home dialysis is better than hemodialysis or in location dialysis?
Okay. So, and I think I heard the person say they had different experience, maybe someone that they knew. So a few things about that. Typically, patients that do dialysis at home tend to do better. The reason for that could be several. Number one, it could be because they are well enough to perform dialysis at home, okay? They might have less comorbidities. They might be younger, I don't know, but that definitely can play a part, right? Because there is a certain subset of patients that we would not even try to do dialysis at home. That could be based on the fact that they have several other illnesses. It could be based on the fact that they might not be able to do it themselves, or they might not have a care partner. But in general, patients that do dialysis at home tend to do better, and they tend to live longer. Could that be because they might have been a bit healthier to begin with? It very well could be. I don't know, the situation that you are familiar with. it is probably true. I would not doubt that there might be some people who are not the best candidates for home and don't do very well. But just in general, patients who are doing home tend to do better. Then the other part of the question, home dialysis is very, very beneficial when you are that good candidate. Okay, a lot of times, number one, it allows for more freedom. You don't have to be in the dialysis unit for 4 hours, 3 days a week. You're able to travel a little bit more freely because you can take your machine with you. People can continue to hold down their jobs or, do whatever social things they like because they don't have a specific time constraint, but they have to show up to the dialysis unit and be there for 4 hours. It's something they can do more on their time. So patients tend to like home dialysis for those reasons as well.
Thank you.
Thank you. Are there any other questions? If so, feel free to raise your hand or
Yes,
we have one more in here.
yes. This is in reference to the blood pressure chart that was up, where you can compare how you fall systolic and diastolic. There was a chart, not the one that was displayed today, but I saw that people over 60 could have a little higher systolic and diastolic and still be considered within the norm.
Did you hear the? So
No, please repeat.
Okay, so we have a question. Is there a chart that is different than the one that you showed today for people that are over 60? For people that are over 60, that shows a slightly elevated or different blood pressure ranges that are considered normal.
No,
that you're aware of.
No. Now, sometimes it can be dependent on the situation. So, if you have somebody that might have had strokes before, things like that, sometimes we can tolerate blood pressures that might be a little bit different. But all in all, those 4 stages are scientifically what's been studied, and that's what's been used. Age is not really a factor. I will say sometimes when I'm seeing patients who are in their 80s or 90s, I am a little more lenient because I don't want to drop their blood pressure and decrease blood flow to their brain, which might give them some altered mental status. But outside of situations like that I'm concerned about, regardless of your age, we are following that chart to control blood pressure.
Are there any other questions? We do want to stay on time. No? Thank you very much, Dr. Kennedy, for presenting with us again this year. We really appreciate you as one of our speakers.
Thank you for having me.
So thank you. Yes, of course. Thank you and have a great day. At this point, we are going to take a very short 5-minute break. Everyone, we will be getting ready to restart. Thank you. Karen, honey, can you turn these lights on? All right. Our next presenter is the wonderful Lisa A. Smith, who is a highly sought after coach and speaker specializing in taking a whole food, plant-based approach to preventing and reversing chronic lifestyle diseases. She holds a bachelor's degree in psychology and an MBA. She is certified in plant-based nutrition, the author of the Plant-Based Foodie Recipe Book, and the creator of 4 proprietary frameworks. She is also the creator of the plant-based coaching program, Farm to Table, and of the plant-based coaching certification, the Plant Protocol. Lisa founded the Black Health Academy in 2017, whose mission is to eradicate the most common chronic diseases which disproportionately impact communities of color. For bookings or to learn more about Lisa and what she offers, please visit her website at www.lisaangelsmith.com. And with that, welcome, Lisa, and we appreciate you attending again this year. Hello.
Hello, Stonebridge and attendees. Thank you so much for having me. It is an absolute pleasure to be here. and an absolute pleasure to be back. So I'm going to share my screen and we're going to kick off this presentation. We're going to have a phenomenal time together in the 40 plus minutes that I have with you all. And I hope that I'm able to say something that inspires you to take radical action in your health. Let's get started, y'all. So as she mentioned, I am the founder of a company called the Black Health Academy. And our mission is to impact the communities of colors who are disproportionately impacted by chronic lifestyle disease, right? And that is obesity, hypertension, high cholesterol, heart disease, kidney failure, and of course, type 2 diabetes. So let me tell you briefly a little bit about myself. So I started the Black Health Academy just noticing the high amounts of inequities in communities of color when it comes to healthcare and battling lifestyle changes. And so I wanted to do something about it. I discovered the power of plants, the power of a whole food plant-based lifestyle, and the power it has to not just prevent, but also combat many of the conditions many of us are battling. And so I started Farm to Table plant-based coaching program, which I have been facilitating since 2016. This is a group coaching program that helps individuals with chronic lifestyle disease adopt a whole food plant-based lifestyle to combat them. But y'all, I was delusional, okay? Because I thought I was going to be able to save everybody at Farm to Table, right? Me and my program coaches, I thought we're going to be able to host cohorts 4 times a year and help everybody. And it turns out it just wasn't enough and I needed help. So 2 years ago, in 2021, I founded the Plant Protocol, which is the first plant-based coaching certification to be founded by a person of color. And at the Plant Protocol, I help other passionate vegans package their passion into a health coaching business. So I essentially duplicated myself, right? Because I was like, I need more culturally relevant coaches out here coaching our people to this powerful lifestyle. And so I founded the Plant Protocol. And then finally, most recently, and this really alludes to what we're about to talk about today, I realized that you can give people all of the strategy, all of the steps, A through Z, and there is still oftentimes something blocking their ability to execute. So last year, I founded my mastermind, Clarity. And this is where we focus on the mindset and the belief systems of individuals to help them elevate their level of consciousness so that they can execute on all the things that they already know. So that's me, and that is what I do. So why aren't you reaching your health goals? Now, listen, I know we got some people in person. I know we have some people on virtual. I like a little energy. And so at least the people on virtual, if I say something, if I drive down your block, if I turn down your street and it really resonates with you, I want to hear from you in the chat. And if it really stings you, I want to hear ouch in the chat, okay? Because I like to make sure that I am hitting the nail on the head and really talking to the people who need this today. Okay. And so here's what I decided. Now, let me say this before we go forward. This is my 2nd year speaking at Stonebridge, y'all. And I want to submit an apology to everybody in attendance today, because what happened last year, if you guys were here, last year I came on and I told everyone all about how to take a whole food plant-based approach to combating type 2 diabetes. Last year, my presentation was all about the power of plants, how we need to eliminate saturated fat and cholesterol because that is at the root of insulin resistance. I talked all about the science of plant-based nutrition as it relates to type 2 diabetes. And I was just giving strategy and I was showing pictures of my meals. And I think I gave y'all my recipe book and we had a good time. But I realized something. When Stonebridge reached out to me this year and asked me to come back, I told them, and they said, what do you want to talk about? And I told them, I said, we got to do it different this year. I don't want to talk strategy. I don't want to talk science. I need to talk mindset. So my apology is this. I apologize for giving you guys the strategy and telling you what to do without telling you who you needed to become. Without telling you who you needed to become. Because how many of you guys know it does not matter how much strategy and information you have. There is a certain person you have to become in order to implement what you know. Does that make sense? And so I want to make sure that we don't just talk about how to eat, how to drink, how to move, where to go, but I need to elevate your mindset and your consciousness. And so that's what I'm going to do today. That's what my plan is today. But listen, hang on to the end, because for those of you who are still very much interested in understanding how a plant-based diet can impact type 2 diabetes, I'm going to gift you at the end with a talk I recently did, breaking that down for the Black Nurses Association. I'm going to gift you with that replay. So you're going to get both today, but I want to make sure I didn't show up with a whole bunch of strategy without talking about mindset. Now, let's get into it. That's my apology. Let's get into it, y'all. So why are you not reaching your health goals? It's the question I want to submit to you today. So my affirmation is this: it's probably because you're asking the wrong questions. Pretty much what I just said, right? What's happening is we come into events like this, we go to our doctors, we go to our friends or in family who maybe have had success. And what we ask them is this: what do I need to do? Tell me what to do. How should I, like, how long do you exercise, Lisa? When you say whole food plant-based, does that mean no cheese ever? Like, tell me what to do, right? How much sugar can I have? That's your favorite one, right? How much sugar can I have? Like, do you mean no sugar forever for the rest of my life? And so when you're trying to get healthy, what we do is we ask, what do I need to do? But instead of asking, what do I need to do? What we really need to be asking is, what do I need to believe? What do I need to believe? So before we even get to strategy, step 1, get rid of dairy. Step 2, get rid of meat. Step 3, drink more water. Step 4, start moving. Step 5, eliminate stress. Before we get to all of that, the very first thing I need you guys to know is what you need to believe. And I'm about to tell you 4 things you need to believe in order to effectively accomplish your health goals. Does that sound good? I feel like I see some head nods in the room. Okay, don't worry about it. I see them. Okay. All right. So let's get into it. What do I need to believe? Because the truth is, you already know what to do. You already know what to do. When we come to events like this, absolutely, we often hear things we've never heard before. But the truth is, you still know enough to get started. Right? You know you're supposed to be eating more fruits and vegetables. You know you're not supposed to be finishing a bag of chips just because your favorite show on. You know you're not supposed to be eating all that processed food. You know you should be exercising. You know you should be doing something about that thing that's stressing you out. The truth is, if we stopped right now, you don't need another ounce of information. You have enough up until this point to do more than what you've probably been doing. And so the truth is, you already know what to do. But the issue is there's something, and I suspect is mindset, that's stopping you from taking it all the way or stopping you from being consistent. Now, I know we got a couple people in the chat. Let me see if I can get them to participate. I would love to hear from 1 or 2 people in the chat. Drop one thing in the chat you know you should be doing for better health that you're not doing consistently or at all. Can I get 1 or 2 people to share that really quickly? Drop for me in the chat at least one thing you know you should be doing for better health that you're not doing consistently or at all. Those of you who are in person, write that down and identify what that is. Call it out. Like, you know what? I know I don't get all my water in. I know I was supposed to stop eating all this fried food. Like, I know. Like, tell me, what do you know that you aren't doing? Somebody said exercise, eating more water, eating more vegetables, water. Absolutely. So there's some things, guys, that we already know to do. And so what's happening is we're maximizing information consumption, right? So we get maximum information with minimal transformation. Maximum information and minimal transformation. Now, this is a problem to me because I'm a plant-based health coach, you know, and I really believe in the power of lifestyle change and lifestyle modification to prevent and eradicate some of these conditions, right? And so it really pains me when people think I'm going to pull out some magic trick and tell them something they didn't already know. Right? When people come to me, they sometimes disappointed, like, oh, I already knew I was supposed to be doing that. Absolutely. You don't need a coach for new information. You need a coach to do what you already know. So I'm about to coach y'all this morning. Sound good? Okay. This afternoon. Okay. It's 12 where I am, y'all. So whatever it is, you about to get coached today. You didn't ask for it, but you about to get it. Here we go. Okay. So let's get into the presentation. The title of my presentation is The 3 Truths and 1 Lie Preventing You from Getting Healthy. The 3 truths and 1 lie preventing you from getting healthy. Here we go. Here's the first one. The first truth that's preventing you from getting healthy is this: everything in moderation is no longer available to you. That's the truth. Now, the lie you've been telling yourself is that I can have a little bit. Now, you know what your little bit is. The lie you've been telling yourself is that I can treat myself on the weekends. The lie that you've been telling yourself is that as long as I do good most of the time, it's okay to have a little bit of the mess, right? But the truth is, everything in moderation is no longer available to you. Let me break this down. Let me tell you why this is a fact. This is a fact because moderation is a privilege and not a right. Moderation is a privilege and not a right. I'm going to break it down a little more. If you can hear my voice right now and your body or your mind is compromised, maybe you're overweight, maybe you have type 2 diabetes, maybe you're on medication for something, maybe you're battling a mood disorder, maybe you're pre-something, pre-diabetic, pre-hypertensive, right? If you are not your most optimal self in this moment, as I'm speaking, you are compromised. And for you to believe that you can still eat a little bit of the mess that got you to where you are is delusional. Moderation is not a privilege, it is a right. Moderation is a right that you earn after you've done the work to become optimal. Does that make sense? Stop thinking that although I'm not at my best, although I wake up with aches and pains, although I'm overweight and it is compromising the quality of my life, although I'm on medications, I can still afford to eat a burger or a steak or fries or potato chips or candy or mac and cheese and fried stuff and all the cakes they're going to present to me on Thanksgiving, as long as I just have a little bit, long as I just do less than I usually would, long as I don't eat the whole bag tonight, but I save half for tomorrow. Stop thinking that moderation is a privilege. You do not get moderation if you are compromised. When you are battling something, guys, when you are battling something, your insulin resistance, your blood pressure is high, your cholesterol is high, you have blockage in your arteries, you're not sleeping well, chronic aches and pains, things are swollen, blood ain't flowing, you're constipated, you're not eliminating on a regular, you're battling anxiety, you're battling depression. If you are compromised, you do not get to moderate a sugar addiction. You don't get to moderate a potato chip habit. Is it making sense? So the first truth that's preventing you from getting healthy is that everything in moderation is no longer available to you. You're already compromised. You have to earn moderation. Stop telling yourself that everything in moderation, every blue moon won't hurt. You got to die of something. A little bit won't kill you. Not true. Not true. Not only that, you've moderated yourself to the health status you're at right now. Do you know you didn't get that diagnosis from one meal? You got it from moderating over the last few years and months, eating a pizza here, a donut there, a coffee there, a sugar here, something smothered with cheese and butter there. You moderated yourself to the current diagnosis. You're not about to moderate yourself out of it. So let me tell you something. If you're battling type 2 diabetes, if you're battling obesity right now, if you're battling hypertension right now, your solution is abstinence, not moderation. Your solution is abstinence, not moderation. Stop avoiding the hard work of getting well. Y'all ready for number 2? I don't know if number 1 was so harsh that they don't cut my mic off, don't cut my volume off, allow me to keep going. But I hope y'all ready. That's the first truth. And it is not going to get any easier to hear from here. So I was like, Lisa, let me put the lightest one up front. Like, that's what I thought I was doing. Let me put the easiest to ingest one up front. So I hope y'all are ready for the next one. Okay. Let's get into it. The second truth that's preventing you from getting healthy, is this. It's not your mama's fault. I'm gonna pause. It's not your mama's fault, okay? It's not your grandma's fault. It's not your grandfather's fault. It's not your great-great-grandmother's fault. It's not your uncle's fault. What are you saying, Lisa? I'm saying stop coming to us talking about this runs in your family. Yeah, to let yourself off the hook for a diagnosis that was preventable. It's not your mama's fault that you overweight. I get that everybody is overweight in your family, but yet and still, this is a lifestyle disease. Okay? This is not your DNA. Does DNA matter? Absolutely. Does genetics play a role? Absolutely. Can you be predisposed for something and more likely to get it than the person sitting next to you? Absolutely. Well, what plays the bigger role is your daily choices and what you eat, how you move, where you work, who you love on, who loves on you. That's what matters. It's not your mama's fault. The lie you keep telling me and your doctor and everybody else, this runs in my family. This runs in my family. When you say that, you give your power away because you're saying, listen, this was the genetic code I was dealt. Like, what am I supposed to do about it? I'm going to tell you what you're supposed to do about it. You're supposed to take ownership. Your DNA does not determine your health outcomes. It is data that you use to inform your decisions. Oh, several people in my family battled this. I better take precaution as I proceed. Does that make sense? Right? But your DNA does not determine your health outcome. Your DNA doesn't have the final say. Your DNA is not expressed just because you have it. It is expressed by the choices you make. I determine when my genes express themselves. I tell them when to talk. They don't just get to come up in here diagnosing me with stuff. I tell my genes when to talk. It's not your mama's fault. It's your fault. You've been eating that mess. You've been sedentary. You've been staying in relationships that you have outgrown that are stressing you out. You've been staying in jobs and volunteer roles that stress you out, that no longer fill you up, but you're too afraid to let go of. Like, that's your fault that all that stress and inflammation is. You got to own your behavior. Listen very closely. You need better running shoes. Okay, I'm gonna slow down for this one. I hope they catch it, y'all. You need better running shoes. Let me slow down real quick before I say this. Lisa, catch your breath. Okay. The next time you tell me something runs in your family, you better be following up with, but you training for a marathon. Okay, I'm gonna slow it down. I don't know if they caught it. The next time you decide to say that something runs in your family, I immediately expect you to follow up with the fact that you're training for a marathon. Why? Because you're about to outrun it.
Come on,
It ain't gonna run past me on to the next generation. You need better running shoes. If all this mess, diabetes, cancer, Alzheimer's is running in your family, we need better running shoes. Does that make sense? Let me tell you a story. Okay. So just this week, this is just top of mind because it just happened this week. So my mom, she takes my program Farm to Table. She's taken it several times just because she got mom privilege and she don't have to pay. Okay. Shout out to mom privilege, right? So literally just this week, y'all, she's taking Farm to Table right now with me and other students. And she posted in our private group chat. She's like, just got my labs back. Cholesterol down 30 points. I'm under 190. I'll tell y'all that story later. But she was like, and my A1C is now 5.7. And she was like, Lisa, this is good because, diabetes runs in our family. And so what happened is we were able to get her some running shoes and she was able to outrun the diabetes. Now, when I say running shoes, let me be very clear. Running shoes are nothing but a vehicle, like a plane, train, or automobile. And so a vehicle gets you from one place to the next, okay? And so my mom's quote unquote running shoes in this example was a whole food plant-based diet. We used a whole food plant-based diet as the vehicle for her to outrun the diabetes that allegedly runs in our family. And so what I need you to decide right now is, what is your vehicle? What vehicle are you going to use to outrun the thing you keep telling us runs in your family? Okay. What vehicle are you going to use to outpace diabetes? What vehicle are you going to use to outpace obesity? What vehicle are you going to use to outpace depression? What vehicle are you going to use to outpace cancer? What vehicle are you going to use to outpace poverty in your family? Stop acting like something running your family mean it was meant to be, that it was the cards you were dealt, that it's just your unlucky hand. It's not your mama's fault. It's your fault and the choices you make. Does that make sense, guys? Does that make sense? Okay. I see people shifting, moving from side to side. Okay. Okay. That's good. That's a good sign. So that's the second truth. The truth is, it's not your mama's fault and you're back on the hook. You are responsible for where you are today and you have to own it. And the good news is there's things you can do about it. Every speaker before me and those after me are going to tell you everything you can do about it. But what you no longer get to do is act like your genetic code is the reason you are where you are. It's not. That's the second truth. Okay, let's get to truth number 3. We're going through them quickly here. Let's get to truth number 3. Truth number 3 that's preventing you from getting healthy, and I'm going to spend a little time on this one. I'm going to spend a little time on this one. Truth number 3. You're only capable of doing better, but you need help to do your best. You're only capable of doing better, but you need help to do your best. So what I mean by this, listen, they say the data shows that the average person is only capable of pushing themselves about to 40% of their true capacity. They say the average person is only capable of pushing themselves to about 40% of their true capacity, which means if you don't have a coach of some sort, you're leaving 60% of capacity on the table, which means every time you make an effort to do better in your health, you're not doing as good as you could if you had the coach, the accountability partner that you needed. Let's just be honest. Now, here's the mistake. I don't know the mistakes y'all make, but I'm gonna tell y'all the mistakes my students make, our clients make, okay, at the Black Health Academy. Here's the mistake most people make. Now, my clients, let me give some background. The majority of our students in Farm to Table, at the Black Health Academy, the majority of our students are exceptionally smart. Like, we collect data on our students, and they all got degrees, and they got advanced degrees, and they got fancy jobs, and they've accomplished things. And let me tell you something, that's usually good. That's usually good news. But in the work that I do, the news ain't that great. Because what happens with smart people is smart people tends to outsmart themselves. And here's what smart people say, okay? Smart people say to themselves, well, I know my problem, so I don't need anybody to help me fix it. That's what smart people say. Smart people come to me and they be like, Lise, I'm gonna tell you right now, my issue is just sugar. If I stop eating sugar, I'll be fine. Like, why would I get a coach if I know my problem? This is what smart people say. They're just like, I know if I just exercise more, then I'll get to where I need to be. This is what smart people say. Smart people outsmart themselves. And here's what I say to the smart people. I say, oh, smart person, right? I say, awareness of the problem doesn't qualify you to solve it. That's wild. Yeah, you can see your tire flat. That ain't got nothing to do with your ability to change it. Awareness of the problem does not qualify you to solve it. And so what happens is you spend months, you spend years, you spend decades on medication, overweight, unwell, because I already know my problem. Why would I employ assistance if I already know my problem? But let me remind you about all the top athletes in the world. They all have coaches. They all have multiple coaches. Why? Because even the best surgeon cannot do surgery on themselves. Even the best surgeon cannot do surgery on herself. That means we all have blind spots. And so just because you think you know what your problem is, that does not qualify you to solve it. But moreover, even when you may be accurate about what your problem is, you are still more than likely incapable of pushing yourself to 100%. But see, here's what people do, y'all. They do better. And so because they're doing better, Lisa, I'm down to only drinking a soda, a couple times a month when I go out to dinner. When me and my husband have date night, that's the only time I drink soda now. I don't buy it in the grocery store, Lisa, anymore. I don't bring it home anymore. Lisa, you'll be so proud of me. I don't fry food at home no more. Nope. You said I needed to be no oil to get over diabetes. Guess what, Lisa? I don't fry food no more. You'll be so proud of me. You'll be so proud of me. And so what happens is we have all these testimonials about doing better. But the reason we're not getting well quick enough is because we're still not doing our best. Let me give you a better example. Let's keep talking about my mama, shall we? So also this week, I told you guys that my mom in our private group, she shared with us that, she just got her labs back this week and her cholesterol dropped 30 points, right? And so we got mom's cholesterol down to 190 so far. We're gonna get it a little lower because I don't like to be that close to the borderline. So we're gonna drop it even more, right? Don't even worry about that. I'm gonna take care of her. But right, she got it down to 30. Now listen, my mom has been my mom the whole time. Me starting my company, me starting Farm to Table, me teaching it, which means she's been taking Farm to Table with me. She's been coming to my lectures. She's been listening to my stuff. She's watched me deliver my talks over and over and over again. And so here's what happens, right? So my mom has taken Farm to Table and she done started doing the stuff, and she's mostly plant-based. She's mostly plant-based. However, she was still eating one thing, y'all. She was still eating one thing. So she did better, but she would not let that salmon go. I said, Ma, you got to let that salmon go. It's really high in cholesterol, really high in fat. I know they tell us it's healthy. I know you think you can keep fish, but I'm telling you, Ma, you got to go all the way. If we want to get you got to go all the way. Guess what happened? She joined my Farm to Table program this semester. Now, we just started in October. We just started this semester. And guess what? She got her lab work done a month later. And now guess what? The cholesterol is down. And she called me and she said, at least it was the salmon. But what happened? It wasn't until that she got a coach that she went from better to best. It wasn't until she employed help and stopped thinking she was Little Miss Know-It-All that she went from better to best. Because here's the truth. Your good has become the enemy of your great. Your good has become the enemy of your great. If y'all listening to me right now and you have been making incremental changes, you've been coming to events like this and getting all this wonderful information, you've been reading books, you've been following people online, you've been listening to podcasts and stories and success stories, and you've been doing better, but you probably haven't been doing your best, because it's hard to push yourself another 2 minutes on that treadmill when you're tired. It's hard to force yourself to order that side salad instead of them French fries, but you're doing better, but you're not doing your best. And so what that means is you still have the diagnosis. You still holding on to some of that weight. You're still dealing with that chronic fatigue because, yeah, you're doing better, but you're not doing your best. And I need you guys to understand that you are more than likely incapable of doing your best without assistance. And some of you guys need to surrender to help. Don't let me come back here next year, because Stonebridge going to ask me to come back. We got a good relationship, right? Stonebridge, don't let me come back here next year and some of y'all are still here with the same issues and challenges. If you're going to make this an annual event, make it so that you've healed yourself and now you're trying to learn everything you can to become somebody else's advocate. Don't come back here 365 days later with the same A1C, with the same weight, with the same problems. From now until then, get help. From now until then, get help, okay? Because listen, if you didn't come from a healthy family, I need you to make sure that a healthy family comes from you. If you didn't come from a healthy family, I need you to make sure that a healthy family comes from you. We have to stop the buck somewhere, y'all. We have to stop the buck somewhere. It's just that simple. It's just that simple. Okay, let's get into the lie. So those were the 3 truths preventing you from getting healthy. Let's get into the 1 lie, because y'all know we're doing 3 truths, 1 lie today. I like fun titles and stuff. So that's what I came up with for today, y'all. 1 lie preventing you from getting healthy. All right, now. Okay, now. Let me slow down on this one. The 1 lie preventing you from getting healthy. Here it is. Here it is. It's normal to be sick. It's normal to be sick. Okay. Now, Lisa, make it make sense for me. The lie that's preventing you from getting healthy is that it is perfectly okay, or at least normal, for your health to deteriorate as you age. The lie that's preventing you from getting healthy is that being on at least 1 medication is all right, because you're doing better than most people. You're doing better than the people, your immediate circle. Like, no, they're on 4 or 5 meds. I'm doing good being on 1. The lie that's preventing you from getting healthy is that being sick is normal. No. Being sick is unnatural. It's unnatural. Stop thinking just elevated blood pressure. Stop thinking that failed kidney. Stop thinking that all these clogged arteries is normal as you age. The lie that's preventing you from getting sick is that being sick is normal. It is unnatural. But here's the problem. I figured out the problem, y'all, because when I was thinking about this, I'm like, why don't people have a bigger sense of urgency when they get diagnosed with something like type 2 diabetes? I was like, Why do people not have a bigger sense of urgency when they get diagnosed with high blood pressure? Why do people not have a bigger sense of urgency when they get diagnosed with high cholesterol or heart disease? Now, people have a pretty good sense of urgency when they get diagnosed with cancer. And so I was like, but cancer ain't even the #1 cause of death in the U.S. Heart disease is. So make it make sense for me. Now, I be thinking about stuff like this, y'all. Like, it be waking me up out my sleep. I'm like, I don't understand why people ain't sprinting to the gym and to the produce section when they get diagnosed with high blood pressure and type 2 diabetes. And I figured it out. I think I cracked the code. And here's the problem. The problem is that your condition is not rare. The problem is that your condition is so ubiquitous that it gives you the illusion that it's not that dangerous. That's what I think it is. That's my theory. Now, I ain't tested it. I ain't took this to the lab yet, so don't quite quote me. But this is my theory. My theory is the reason you don't have a sense of urgency, the reason you're coming back here this year and ain't much changed since last year, is because so many people around you are also overweight. So many people around you also have insulin resistance. So many people around you also have high blood pressure. And so in your mind, it's not that rare. As a matter of fact, we can qualify it as common. And as a matter of fact, there are medications that you can do, that you can live 20 years with it. Like, you can live decades with diabetes. You can live decades with hypertension. And so because it's not that rare, you have no sense of urgency. You're not panicked about it. And you think you can continue to eat junk and mess in moderation. Because look, it's common, right? And so your biggest problem, let me tell you your biggest problem. You might not have knew this, but I want everybody to write down. My biggest problem is, my diagnosis is popular. That's our biggest challenge. Because when you get diagnosed with something like a certain type of cancer, some rare form that everybody don't have, oh, we trying to figure it out. I'm going to do whatever it takes to get whole again. But when we get diagnosed with high blood pressure and high cholesterol and type 2 diabetes, we just drag our feet with it. We'll go out to eat that weekend, eating the same mess that got us to diagnosis. Now, make it make sense. Your biggest problem is your condition is too popular. And so I need you to stop making sick normal. I need you to stop normalizing dysfunction in the body and the brain. I need you to stop thinking that being on one medication ain't that bad. I need you to strive for excellence, not just better, but I need you to strive for your best. I need you to strive for your best. I need you to strive for your best. And the reason is because you've gotten so much permission to be sick, right? So many people around, Lisa, because remember, it runs in your family. So you've seen many family members, friends succumb to these illnesses. And so you already have permission to be sick, but you don't have permission to be healthy. Nobody's giving you permission to be healthy. Nobody's shown you what a 65, 70-year-old looks like on no medications. Nobody, I'm going to show you though, wait for me, I'm going to show you. But nobody has shown you what it's like to age well as you get older. Like I told you, my mom just got her labs back this week. She's in her 60s. We dropped, her A1C went down, her cholesterol went down. She's aging well now. But so many people have given us permission to age unwell. And so because that is our ecosystem, because it is so common, nobody's given us permission to be healthy. And so we've normalized dysfunction. We've normalized being unwell. We've normalized being on medication. And this is the belief that I need shifted for you. Does that make sense, everybody? This is the belief I need shifted. Now, here's what I'm going to do in my last couple of minutes. I'm about to gift y'all with some stuff because y'all going to need some help with this. Like, I done yelled at y'all about y'all mindset. You know, I don't know how my voice be going up like that. I just get really excited. Don't be offended, okay? But I done yelled at y'all about y'all mindset, but I want to make sure you guys have something to take with you, a gift from me to make sure that we really embody the things I told you today, okay? And so here's my gift to you. We got a few minutes on the clock, and so let me gift you. I was supposed to leave time for Q&A, I think, and I don't know what happened. Okay, so here's what I'm going to gift you with, though, okay? I'm going to give you my recipe book. Now, this picture on the screen is a picture of my quinoa meat tacos, y'all. It's probably my favorite plant-based meal. I'm a whole food plant-based vegan, and I make quinoa meat tacos at least once a week. I just finished off this week's batch yesterday, okay? And so this is my favorite recipe. This recipe is in my recipe book along with 49 others, right? But then, most importantly, because here's what I want y'all to do. Remember I said in the beginning, don't come here getting all these strategies and recipes and you ain't changing your mindset. So the most important important thing I'm gonna gift you with is 3 episodes from my podcast that address mindset. Those 3 episodes are episode 16. It's entitled Got Goals? Here's the most important question you should be asking. Episode 19, it's entitled 3 Ways to Become Who You Need to Be in Order to Be Successful. And then, like I promised you guys, I'm still gonna give you the replay of my talk just this year. A couple months ago, I was in Atlanta and I did a presentation for the National Black Nurses Association. And the title of that presentation was The Efficacy of Taking a Plant-Based Approach to Combating Type 2 Diabetes. I'm going to give you that replay. All 3 of these are going to be in the email I'm going to send you. But also, you're also going to get an invitation to get coached by me, because you remember truth number 2, right? You can do better on your own, but you need help to do your best, right? And so I'm also going to give you guys an invitation to get coached by me in my mastermind called Clarity. This is where you will be working with me for a minimum of a year so that we can give you the strategy for eradicating these lifestyle diseases. But then I'm also going to shift your entire mindset and help you to live a life of what I call radical obedience. So then we're going to turn your health into an asset so you can execute on your assignment on this planet, right? And so in order to get the recipe book, those podcast episodes, the replay of my diabetes talk a couple months ago, and an invitation to work with me, just scan this QR code. Just scan this QR code. I'm also, for the people who are on the Zoom, maybe you're on your phone, I'm going to drop the link in the chat as well. Okay. Scan this QR code and you can grab your gifts from me. Because listen, don't leave this here, y'all. We get motivated in the moment and then life start lifing and we go right back. So I want everybody to make sure they have something to take away so that we can continue to work on your mindset and your belief system so that you can start doing the work you already know to do. I think that's it for me. Did I make time? Did I make time? I think I might have made it. So let me drop the link in the chat. Scan that QR code. I'm going to stop sharing. And I'm going to drop the
definitely made time, Lisa. Thank you so much. Yes, awesome. If anybody does have questions for Lisa, let us, feel free to raise your hand. I don't want to say shout them out, but feel free to raise your hand. If anybody inside has any questions, thoughts, comments. That was an amazing presentation. It was very insightful. Mr. Felton, I see your hand. Please feel free.
You know what? These speakers y'all got today are just outstanding. I mean, this Lisa here, she must have been talking to my wife this morning because she's a 30-year registered nurse from the University of Chicago. And boy, you are something else. So that everybody before you or after you, and man, you something else. That's all I want to say. God bless you. God bless all y'all. Man.
Thank you, Mr. Felton. And yes, Miss Ollie has been doing an amazing amount of work for the 15 years that this organization has been an organization. And we are just working and building on that, but her name definitely holds weight. And so we get great speakers like Lisa and Dr. Johnson and Dr. Kennedy and Dr. Mason and Dr. Spicer coming up next. So yes, we appreciate all of your efforts and all of those gifts that you are sending. Now, when you do send that, can I send that out to all of the participants today as well? Will you send that email over? Okay, awesome. I'll make sure that everybody gets that as well. All right. Any other questions, thoughts, something you want to share? Those 3 truths and a lie, you really hit me. You definitely, I don't know if you saw the heart, but yes, I felt each and every one of them. Each and every one of them. So yes, Miss Ollie has something she'd like to say.
Why do you think
I didn't hear it.
Millicent, can you repeat Ms. Ollie's question?
Yeah. Why do you think, the question is, why do you think people choose medication over changing their lifestyle?
Convenience. Yeah, we're unnaturally obsessed with convenience, right? I mean, it's much harder to get off the couch and go to the gym. It's much harder to choose, plants over fries, right? So it's convenience, but also and also because with the lifestyle diseases, you can live so long on medication, Right. So it's not like you take the medication and it's that people feel like people are on medication for decades. And so also we don't understand the threat because you actually can live a really long time and be medicated. So I would say those are two primary things. And then in some instances, it's just a lack of knowledge, right? Just we don't know that lifestyle really has the power to change things, right? So it's usually one of those three.
Anybody else? Yes, thank you very much. And that definitely, yes, that's accurate. Thank you very much, Lisa. We are going to take a quick 10-minute break, I think, right now, unless Lisa, you have something else you want to share with us. All right, welcome back, everybody. We are going to get started. While you are working on that, I'm going to go ahead and introduce Dr. Terry Mason, who is the Chief Executive Officer of Trevention, Treatment and Prevention for Life. Prevention aims to help prevent and decrease the burden of chronic diseases by educating audiences about how food either contributes to the quality of life, longevity, and or demise of populations. Dr. Mason actively serves on multiple boards, including the Community Health Advisory Board of the Urban Health Program at UIC, and the Vice President of the Board of Health Policy Institute of Chicago. Dr. Mason is also a member of the Cook County Physicians Association. He has appeared in the following documentaries and film: Diet Fiction Health in 2019, The Food Cure in January of 2019, Game Changers, September 2019, Forks Over Knives in 2011. He has hosted his popular radio show, The Doctor in the House, on WVON 1690 AM for 30 years. He hosts Restart for Health meetings at Trinity United Church of Chicago, and is a weekly guest on Couch Conversations with Congressman Danny Davis, all of which allow him to share his message to the public concerning health and wellness. Aside from his busy professional life, Dr. Mason dedicates his time with his family, cooking, traveling, and attending school and sporting events with his family. And with that, Dr. Mason, I will turn it over to you. Thank you very much for joining us today.
Thank you so much. And I just want to say, I want to thank Stonebridge for putting on such an amazing program today. Miss Lisa is too much. I'm loving it. And I just want to, at some point I need to talk with her because it's amazing. We have kindred spirits. And I think it's because we're both trying to do the same work for the same folks for the same reason. And what she laid out was just amazing in terms of the things that get in the way. So the other thing you see on the screen is called God's Farmacy. That's my latest company, God's Farmacy. And actually, the pharmacy is supposed to be spelled with an F. It's F-A-R-M-A-C-Y. And the reason I'm saying it because if we ate out of God's Farmacy, the F-A-R-M-A-C-Y, which is a farm, we would need less out of man's pharmacy. So that's what that is. And the question central is one that was just brought up and really amplified by the previous speaker is, do you want to be well? That's not a quote from me. That's from the Bible, from John 5. And the real question is, in all of this, that's the first question you got to ask. Do you really want to be well? You want to talk about it or you want to be it? And so what you heard earlier, just before I started here, is just what needs to be done. And the thing is, you have to do it. It just doesn't happen. And if you don't want to do it, that's because you don't really want to be well. And I got a whole lot of things to talk about in that regard, and I'll be building something around it. But let's go ahead and get started. I always start with this slide, Dr. Imhotep. Dr. Imhotep, as lauded by the founder of the Johns Hopkins Medical School Johns Hopkins Medical School, who is Sir William Osler is his name. And what he did is chronicle the fact that Dr. Imhotep, Mr. Imhotep, was not only a physician, but he was a surgeon. He did multiple operations. He did a number of things. He was also an astronomer. He is also one who helped build the step pyramids in Egypt. And I always want to start with him because he is really the beginning. Because even though even though Hippocrates is credited as being the father of medicine, this man, even through the discussion from Sir William Osler, really gives Imhotep the real title of the father of modern medicine, because Imhotep was doing the things that Hippocrates did, but he did it 1,500 years before Hippocrates. So that's why I always like to start with this. Let's go. Next slide. And the thing I always like to say is that, and what we hear is this thing about prevention. And there's really two types of prevention. There's the primary prevention that really stops the thing from ever happening in the beginning. And the other thing is as you go forward while you're trying to manage it. And so what we really want to talk about, what you've heard us talk about, is primary prevention. Let's see what we could do to stop these diseases from happening in the first place. Next slide. So this is about what is cancer, how does it start? And previous speakers have illuminated this a bit, but the one thing we want you to understand is that most of these diseases, and we're going to get to this, are really reactions to the inflammation that we purposely cause to ourselves by the things that we eat. So these things here are important that I put. I'm not going to read them for you. You can read them for yourself. But let's go on to the next slide, because there's a lot we got to get to, and I want to make sure. Now, we've talked a lot about cancer. And what cancer is just unregulated cell growth. So if we can start the slide, I just click on it, and you'll see that the cells beginning to divide and multiply themselves. And what happens is that these cells, as they're dividing and multiplying themselves, they're doing it without any things stopping them. These cells are going to go very fast. And you can see the normal cell division, and you can see the cancer cell division, and you see these cells growing more and more and more, and they'll look like the original cells, but they don't function like the original cells, which is why when we get cancers, these cancers don't allow our body to function as they should, because we're not producing the right kinds of cells. And this is just a picture showing how fast these cells have grown, so much so that they're going to be crowding themselves pretty soon, and then hitching a ride in the bloodstream to go to other parts of the body and set up the same thing. So this is what cancer does. It starts it like this, but it begins to spread throughout the body. We call that process metastasis. Let's go on to our next slide. All right, this is a picture from a booklet that was a photojournal that was done by a young person who went throughout the world taking a picture of a week's worth of food for many, many families. I didn't put the ones in from India and from some of the other countries where they have basically, as you just heard, plant-based eating. But if you look here and you look at what he saw with the African-American family that he did photograph, you see here not a lot of fresh foods. On the other ones, you would have seen rice, peas, all kinds of stuff. But what you see in this picture is a lot of processed food. And a lot of this food that you see here, though popular, is actually the source of why we don't do as well as we should, because this is what we're putting in our body, and it's causing what you're going to see in the next slide, which is the other movie that I want to show you. So we're going to go to this next slide, and we'll let the audio come through as well. This is Dr. Caldwell Esselstyn.
Was publishing his China study. Dr. Esselstyn was getting some powerful data from the research he'd started in 1985. He began with 24 patients, but 6 had dropped out in the first year, a total of 18.
At the end of 5 years, we had follow-up angiograms, and 11 of the group unhalted their disease. There was no progression. And there were 4 where we had rather exciting evidence of regression of disease.
These results were astonishing. The diet produced something that medication and surgery never had before: actual reversals of heart disease. The biological mechanism that caused these reversals centers on the lining of our veins and arteries, the endothelial cells.
They are the absolute life jackets of our blood vessels. You're young and you're a teenager, you're healthy. You could spread those out one layer thick and you'd have something that would cover 6 or 8 tennis courts.
In 1988, scientists discovered that endothelial cells manufactured the gas nitric oxide.
Well, what does nitric oxide do? Nitric oxide keeps our blood flowing smoothly without being sticky.
It also helps to dilate constricted blood vessels during physical activity and inhibits the formation of plaque.
And most importantly, nitric oxide is a powerful force for eliminating the inflammation that seems to go with this plaque.
However, scientific tests have demonstrated that when we start eating the typical Western diet, our endothelial cells are damaged.
When you're getting to be in your 40s and 50s and 60s and you've been slaughtering your endothelial cells, you don't have those 6 or 8 tennis courts. You may be down to 1.5 or 2, and they can't protect you.
Yet according to Dr. Esselstyn, when we begin eating a whole foods plant-based diet, the damage to our endothelial cells not only stops, it starts to reverse.
And this is the most important thing you need to know. This is the most important thing you need to know, because, and I've shown this over and over again, this is from, this vignette is from the movie Forks Over Knives. And it is really the thing that is going to support what I'm getting ready to say next. And what that is that we've been programmed to think of a stroke being something in the brain. We've been thinking of a heart attack being something in the heart. We talk about heart disease and what have you. But heart disease is really not heart disease. It's not. Vascular disease, where your blood, you end up losing toes and parts of your leg and what have you. These are all food-borne diseases. You just saw how the endothelial cells, the inside lining of your blood vessels, are destroyed by the foods that we're eating. And our bodies are trying to heal, but as we try to heal, the next onslaught of the food that we're eating that caused the first one comes back in and starts up the same process all over again. And so what I want people to walk away with is understanding we've got to stop thinking of these things like they're different. There's no such thing as heart disease. The so-called thing that we call heart disease has to do with the heart at the end, but at the beginning, it's the blood vessels that feed the heart that are damaged. And when the blood vessels that are feeding the heart are damaged and the blood can't get to the heart so it can get the blood it needs to function, then it stops. That's called a heart attack. Same thing happens with a stroke. There's nothing wrong with the brain, but the blood vessels feeding the brain, because of what we're eating, get blocked by the reaction to the inflammation caused by the foods that we're eating, blocks certain parts of the brain, and whatever part of the brain that it blocks, whatever function that part of the brain did, was lifting your hand, lifting your leg, keeping your speech, able to open your mouth, smile, or what have you, that's what the problem is. My whole point is that I want to leave you with one thing, that we don't have a bunch of different diseases. What we have, stay on this slide because I'm going to talk about this in a minute. We don't have a bunch of different diseases. We have one disease, and it's caused by the food that we eat. It's just that simple. Now, I'm not asking you to believe this because this ain't church. What I'm asking you to understand that this is as a result of multiple years of research and looking at all kinds of information. Now, this slide that you see here, because you know what I always said, Black folks got this, more of that, and we're going to do worse with this, that, and the other. Well, that may be true because we've been doing more of the bad stuff than we normally should be doing. What this slide is from was a study that was done with under the leadership of the person who was the past president of the American College of Cardiology, who worked with us to put together this protocol. And it was really to look at, this is Dr. Kim Williams, and what we wanted to look at, well, wait a minute, everything with Black people can't be bad. We just haven't had any good news to tell. We haven't put it out, and that this is the first, it's not a complete study. And to be honest with you, we want to raise about another $1.5 million to do this in a much bigger way to prove there is absolutely nothing wrong with Black people. What's wrong with us is what we eat. And that's what creates the problem and the amounts of it that we eat. So what this slide shows is that what we did is we had everybody, about 50 people, agree. And what we did was we measured all these blood things before they started. We they ate whatever they normally ate, and we measured these markers. And the one marker I want you to pay your attention to is the one that's to the left. And at the top of it, if you can see it, it says TMAO, TMAO. That stands for trimethylamine oxide. This is a very potent thing that creates inflammation in the blood vessels. So what we did, the reason why you see where it is now, this was before we put them through the study. And what we did was we took these folks and asked them to eat only what we gave them, which was a plant-based diet, 100% plant-based diet. And we asked them if they ate anything else to make sure that they wrote it down. But I must admit the folks were very, very, very compliant. And this was over the Lenten season. So this meal we ate, this is all they could eat. They could drink water, but they couldn't eat anything else. And what you see here is that this inflammatory marker, the TMAO, one of the most potent inflammatory substances, and we make it, and we get it from things more like cheese, liver, and other things, and it's oxygenated in our bodies. But what I wanted you to show here, in just 4 weeks of eating a plant-based diet, many of us had almost reductions of over 40%. In 4 weeks, there is no medicine on the planet that does this. And we want to do a bigger study with more people, multiple churches, and get the same results, because what we want to try and show us is that there ain't nothing wrong with us. There's nothing wrong with us. What's wrong with us is what we eat. And that's why we get so many diseases, is because of what we eat. And we've convinced ourselves, for whatever reason, that it's okay. Let's go to the next slide. And so what I want, that was it. That was the last one. I'm sorry. And so God's Farmacy, and it's spelled Farmacy. And the whole reason that I'm really pushing this is because, number one, I've decided that the most important thing I can do to help our people is work on growing our own food. Because until you grow your own food, you don't know what you're eating. And so we've teamed up with other folks. We were out at the Vernon Park Church of God working with some folks there. We'll be out working in some other places at some point in the future, and we'll keep you posted at that. But what we want you to understand is that when we grow our own food, and we grow it, what we grow in a sustainable way. We don't use any organophosphates, no fertilizers or any of those things that help create problems with more inflammation eating the foods that we eat. The point I'm making here is this. Number one, there's nothing wrong with Black people. Number two, we get amazing results when we eat what we're designed to eat. And when I call it God's Farmacy, that's Farmacy. Because in what God has produced, and I know this may sound a little churchy, but it's okay. But these things that are the normal things that we need to eat, the things that come out of the farm, out of the ground, we may call it plant-based, we may call it all kinds of stuff, but the bottom line is that we need to eat our food that comes out of the ground, as opposed to stuff that walks over it, swims in it, and so on and so forth. That clip that you saw was from Forks Over Knives. You heard earlier there was other movies that you could watch, And this is not for your entertainment, but it's for your education. And what we want to do is make sure that you understand that, as the previous speaker did a magnificent job, you got to take this into your own. You can't be passive in this. If you want to be better, just like to give another scripture, when there was a man who was laying in the place by this place called Bethesda, where it had been on a mat for 48 years. And Jesus walked by and asked the man, did he want to be well? And I want to leave you all with that question. Do you want to be well? Because if you do want to be well, you got to do something. He told the man to get up, which means that he wanted the man to stand up. Why did he want the man to stand up? He wanted him to stand up because he wanted you to change your perspective on your life. We want you to stand up because we want you to understand there's another way. And you stand up by taking this other way. And you've heard about it all this time, plant-based eating. That's not some diet. I'm not interested in any diets. I'm diet. I don't even want to have any word with the word die in it. I want, as Prince Asiel used to say, we should be on livets, not diet. And we should be eating the food that give us life. We know that these processed foods that we're eating, we already know, but established by the International Agency on Research on Cancer, that we already know that eating one hot dog or 4 pieces of bacon will increase your colorectal cancer risk. That is your risk of getting cancer by 18%. One hot dog or 4 pieces of bacon. Now, that may not sound like much to you, but it's enough. And it's not what you do once, it's what you keep doing over and over again. I agree too. There's no such thing as everything in moderation. No, that's a lie. That's a step to getting you to do the wrong thing. Because no, I don't want to be moderately sick. You shouldn't want to be moderately sick. You shouldn't want to have a moderate amount of cancers. We need to do these things because this is the way that we can get well. And we have to eat, you call it plant-based if you want, but we need to eat the things that are grown in the ground in the proper way that gives us the nutrients that we're supposed to get. The sun provides us with all of these chemicals. You heard him talk about earlier, these phytochemicals. You see them in a rainbow, these things that are different colors, greens and reds and yellows. Those chemicals are also created in the plants. And when we eat the plant, we get the benefit of it, whether it's fruit or vegetable. That's what it's for. So I'm going to stop right here. I get excited about this, but I get excited about it because I'm supposed to. And I'm going to stop and ask if there are questions.
Thank you so much, Dr. Mason, for that amazing presentation. You are definitely getting applause here, and I'm sure online as well. Does anybody have any questions? When you do have that information for Vernon Park, the farm there, because I know you do a lot of work there, will you please share that with us so that we can share with our email list as well?
Absolutely. What we'll be doing, we're at the end of the season now. We've got one last harvest because we're getting into the winter months. But what we will do is when we start, we operate also what's called a community-sponsored agriculture. So what we like to do, and we'll hear more about this in the spring, what we do is allow people to buy a share. And that share entitles you to food for the entire growing season. And that food is picked not more than 24 to 48 hours before you get it into your home. And we're looking at some different ways of making sure that people can get it. But this is what we need to do. And we need to grow it ourselves. And we need to be clear that we're getting the food grown in a way that gives us the kind of nutrition that we need. And that's what I'm spending the rest of my life doing. I'm not ever going back into clinical practice. I don't want to go back into clinical practice because that's not what I want to do anymore. I want to see if we can avoid people having to see doctors. And if we eat right and drink water, nothing substitutes for water but water. And if we eat things that are plant-based, you heard many speakers talk about this morning. This is not a fad diet. It's not a diet or any. This is the way we're supposed to eat. And those of you who are And you'll hear me give a lot of biblical things about this because that's what's changed me. And I know in the beginning it said, I give you every seed bearing plant, they shall be yours for food. Now, maybe some people have some additional interpretations, but I want us to understand that we can be well. We don't have to be sick. We're sick because we're being lulled into a false sense of security. We've been lulled into a drug industry who makes money by managing sickness, whether it's dialysis, diabetes, high blood pressure, elevated cholesterol. It's not about you don't get a pill that from anybody that cures you or anything. The only thing that can actually help cure you is to eat the stuff from the ground. That's the only cure. The rest of this stuff is never going to cure you.
Mm-hmm. Well said. Well said. Does anybody else have any questions?
Where is he located? Because I was at Margaret, and they were talking about the concept of buying into shares.
Mm-hmm.
And I was out in Salt Village, and they had a farm, and people would come, and I guess each month they would get certain specific foods or amounts based on what their shares were.
So Vernon Park Church or farm that you were referencing is located in Lansing?
Yeah, Linwood. That's Lansing, but it's in Linwood.
That one is in Linwood.
Now, what we're going to be doing is I will make sure that as we gear up for next year, I will make sure I'm going to make a special thing going out to the southern suburbs. But I want to make sure everybody knows I'm going to visit every church. I'm going to visit everybody out there because I want everybody to know what we're doing and to have an opportunity to participate at the beginning. You won't hear about that till the spring because that's when we start planning again in the spring. And what we're going to be doing too is trying to figure out some ways to do some additional things so that we can have some things during the winter months as well. So there's going to be a lot. Stay tuned. I won't keep it a secret. You'll hear it on my radio show and you're going to hear about it. I'll come back to that because you guys do such a great job. I want to come back and make sure that we let in the spirit of your founder, Miss Ali, we have to do a better job. And ain't no cavalry coming. Ain't nobody going to come fix this but us. And it's going to be up to us. And it's not going to be a choice. This is what you're either going to do or not. And you want to choose life or you want to choose death. The choice is yours.
Yes. Yes. Thank you very much, Dr. Mason.
You're very welcome.
Thank you.
Thank you. Our next and final speaker is Dr. Spicer. The podiatrist, Dr. Stephanie Spicer, DPM, provides foot and ankle evaluation, treatment, and surgery to patients at her practice, Foot and Ankle Group in Olympia Fields. Serving the greater Chicagoland, Dr. Spicer strives to educate her patients so they can be involved in their treatment and make informed decisions. Dr. Spicer has maintained surgical board certification for over 20 years, even though she just looks so young. She completed orthopedic and surgical residency programs at Hines Loyola Hospitals and St. Joseph Hospital in Chicago, Illinois, respectively. Her postgraduate training included, but was not limited to wound care, sports medicine, reconstructive rear forefoot surgery, and trauma, as well as foot and ankle problems related to systematic disease. And with that, thank you very much. I'm going to turn it over to Dr. Spicer.
Hi, everyone. Thank you for the introduction. It's such a pleasure to be here. This is year 3 for me, and I am always impressed with all that Stonebridge is doing for our community and for people with diabetes. I'd like to give a shout out to Ms. Ali Smith and a belated birthday wish to her. The reason that I know about Stonebridge is because she was my patient probably 15 to 18 years ago. And I remember her fervor for plant-based diet, and even moreover, making sure that her community had resources that they need to stay well. So with that, can we start with the slides?
Yes, I will share my screen. I wasn't positive if you wanted me to do it or not. But
yes, please.
No problem. No problem.
Thank you.
Yep.
So again, this is me. My location is 19900 Governors Drive in Olympia Fields. My website is there, FlanecoGroup.org, and we can forward the next slide. So diabetes, well, you guys have heard about it all morning. Dr. Ansel, Dr. Kennedy, Dr. Mason all touch base on what diabetes is. The short of it is, the problem is excess glucose in the bloodstream. And glucose in overabundance can be a very destructive molecule. And that's the problem. Demographics are sobering these days. 1.4 million Americans are diagnosed with diabetes every year. I think the current number is approaching 38 million. And even more so, there are 8.5 million people who are undiagnosed. So it is, again, I think Dr. Mason mentioned by 2050, 1 in 3 Americans will be diagnosed with diabetes, and that's very sobering. So how does diabetes affect the foot? I'm going to say the top 3 things are affecting the blood vessels by creating an environment where there's decreased blood flow, affecting the nerves so that normal sensation is diminished, and lastly, affecting the immune system where the body can't heal or fight infection normally. Next slide. So what does that mean in the land of podiatry? The biggest issue with people that have diabetes is they're at a greater risk for foot infections and foot ulcerations. The things that we just discussed, the issues with the blood vessels and circulation causes decrease in skin integrity and the body's ability to handle the stress. If you think about the feet, they take a tremendous load every day. Ground reactive forces, our weight, they're the vehicles for locomotion for our body. Lack of sensation is a huge problem because sensation is basically our discernment for danger or insult. If that doesn't exist, it creates a perfect storm for foot ulcers or infections. Decreased blood flow, again, the inability to heal as quickly when injured, and or tissue death or atrophy. Next slide. So here's the big of it, the big and ugly. Whenever a diabetic patient gets foot ulcers, number one thing that happens is infection. And mind you, an ulcer is actually just an open sore. Infection, we already discussed, is pretty difficult when you don't have adequate blood flow or immunities. And so cellulitis, which is soft tissue infection, can quickly escalate to osteomyelitis, which is infection in the bone. Really, the foot is basically made up of bone, skin, fat, ligaments, tendons, nerves, and blood vessels. So there's really not a lot of soft tissue there that protects the bones per se. And whenever we get to a point where there's osteomyelitis or infection in the bone, then that becomes a surgical issue 90% of the time. And believe it or not, osteomyelitis can too escalate and create a life-risking situation in sepsis, where bacteria enters the bloodstream. Next slide. So what can you do if you have diabetes and you're concerned about your foot health? You know, from everyone who spoke today, it is clear that diabetes is very, very complex and not an easy situation to manage. And so resources are absolutely paramount. Resources that I want to talk about today include medication, nutrition and nutritional counseling, lifestyle and lifestyle amendments, as well as regular diabetic foot care. Next slide. I love, by the way, what Miss Lisa Smith said. You're only capable of doing better, but you need help to do your best. So I'd like to think that these resources are help, if you will, for all of us to do our best. I'm going to be a little transparent with you today in that I have a recent testimony. I was diagnosed with prediabetes about, I'm going to say, going on 2 years ago. And I have a phenomenal endocrinologist who really sat me down and explained to me how she wanted to manage my situation, understanding that I'm a working woman, business owner, very busy, highly stressed. So she looked at me as an individual and she said to me, I would like to put you on medication. Of course, I balked at that. That was not my desire. However, she did explain to me that she wanted to guard and protect my liver, my kidneys, my blood vessels, my eyes, my nerves, and my immune system while I figured out how I was going to make life changes and hopefully not need medication. So I'd like to say that medicine is not necessarily the devil we make it out to be. For me, it was a blessing for a time such as I needed it until I could get a hold of and manage my lifestyle. Next slide. Nutrition. Oh my gosh, that is such a journey. So all of these things here were part of my journey in kind of getting a handle on nutrition. Most doctors, when you go to their office and they talk about diabetes, the short of it is don't eat sweets and don't eat carbs, which makes one ponder, like, what are we supposed to eat? The American diet is loaded with all of that, per the lovely photograph that Dr. Mason shared that kind of brought it all to our attention. So one of the things that I did that was a game changer for me was I got nutritional counseling. And that is available to everyone. Nutritional counseling is covered by insurance. Metabolic analysis for many people are also covered by insurances. I offer both of these options to patients that come into me that seem to be unclear about what to do for themselves with new diabetes diagnosis. And the majority of them deny or decline for whatever reason. I think it all sounds scary, but the truth of the matter is it's extremely helpful. For me, it helped me get to know myself physiologically. And knowing yourself, knowledge is power. You can actually feel nuances when your body is out of order. So I think counseling is absolutely necessary, and I wish it was mandatory for any and everyone who is diagnosed with pre or diabetes. The other thing that I learned is that meal planning is absolutely paramount. There is no way that you can eat appropriately without a plan. One of the things that I really think gets Americans in trouble is the fact that we're spontaneous eaters. You know, we eat for joy, pleasure, celebration, church, you name it, we're eating. And quite often we're not eating at home, or we're not eating with foods prepared by our hands. We're buying them. And unfortunately, we know that that is a recipe for disaster. An option that I exercised, which was very, very helpful, was that of delivered meals. There are many, many, many products on the market, and they're inclusive of meal plans for people with diabetes or vegans. My favorite out of the three, Bistro MD, HelloFresh, and Nutrisystem, was HelloFresh. I really enjoyed the fact that they delivered fresh produce and recipes along with that that were easy to use. My meal plan was inclusive of meals that took less than 30 minutes to prepare because I have very little time. But they really helped me learn how to manage ingredients so that food is flavorful as well as healthy. And my family even got involved in preparation. So it was really a great learning experience for all of us. Next slide. Here's a big one. I talk about this with all of my patients, and that is get moving. Lifestyle change starts with exertion, walking and exercise. It is recommended that all of us get at least 150 minutes of exertion every week. That's 20 minutes a day. And that's not walking. And that's not walking up a flight of stairs. It is consistent for 20 minutes. It includes brisk walking. And for those who can't walk, of course, the wonderful QB bike, where you sit in a chair and you just, like you're riding a stationary bike, or any exertional movement that is ongoing for 20 minutes. Next, walk a minimum of 7,000 to 10,000 steps a day, 3.5 miles. Another little personal story. So how do you know if you're sedentary or not? Of course, I presume that I wasn't sedentary. I see patients from 9 to 5 o'clock, 4 days a week. Once or twice a week, I'm going to the hospital doing rounds, or I'm in surgery. And I have a 3,000 square foot office. So I was absolutely sure that I was getting appropriate activity. So I started wearing a pedometer, and lo and behold, my average number of steps per day at work was only 4,000, which puts me in the sedentary range. So for all of my patients who tell me, oh, Dr. Spicer, I never sit down. I'm always moving around my house and I have stairs. I like to let them know it is probably not enough. Everyone needs to plan for exertional activity every day. If you are not planning, if you are not implementing that into your day, you are sedentary. Next slide. So here's a resource, Silver Sneakers. Silver Sneakers is a name for a program that was dubbed by insurance companies. And it is basically a health and fitness program designed for adults 65 and over, and it's included in most insurance plans. Silver Sneakers can be found anywhere. You can find programs online. You can find them at your local health clubs. And they're really designed with amendments for people who are older or not able to do high intensity interval training. Some of these exercises can be done in a chair, sitting on your bed, but they all encompass the requirements of movement, exertion, and walking, or something consistent with walking. This is the site, www.silversneakers.com. You can go to that site and you can actually enter your insurance information to see if it's a covered service for you. And you can also put in your zip code to find out what healthcare facilities or fitness centers provide Silver Sneakers programs. Next slide. So here are the effects of walking and exercise. And I think it covers every box of everything that we discussed today. It improves cardiac health. It lowers blood sugars. It creates stronger bones, joints, and muscles. Also diminishes arthritis. It helps to slow cognitive decline. It increases your mood, reduces aches and pains, improves circulation, that blood flow thing, improves immune health, and it also increases social interaction. That's a win on every level. Next slide. So back to the foot or feet. It is my job to be the foot police. Any podiatrist that you see, that is their job. We recommend at least 1 to 2 diabetic foot evaluations every year. An evaluation consists of inspecting your skin on your feet, your nails, your integument, as well as your blood flow. We check your pulses and sometimes do vascular duplex studies when needed. We check your sensorium to make sure that your sensation is adequate. And for those patients who have other problems in the orthopedic realm or comorbidities that predispose them to ulcers, we see them 3, 4, 5 times a year to make sure that those things are being managed and don't escalate. Ideally, I would like to be a preventer versus someone who treats problems after they occur. A good thing to note is that insurance plans cover diabetic foot care. So it's a resource that's readily available to all those people who are insured. Additionally, most insurances cover 1 pair of therapeutic shoes for people that are being treated for diabetes per annum. Those shoes often come with inserts that are protective, and also we can make prescription or customized inserts based on each individual's needs. So there's really no reason not to take advantage of podiatric services if you have diabetes. Next slide. So the crux of my talk today was really about resources, and we've heard so many today. Stonebridge in itself is a huge, wonderful resource. God's Farmacy, clearly. Miss Lisa Smith. Lifestyle changes, nutritional counseling, medication, and foot exams. Those are all resources available to all of you. And so what is a resource? Finally, it is a source of supply, support, or aid, especially one that can be readily drawn upon when needed. So I just implore everyone, use your resources. You have many from today, and you can't do it alone. Miss Lisa said you are only capable of doing better, but you need help to do your best. Help is in your resources. With that, I thank you, and I'll take any questions that anyone may have.
Thank you very much, Dr. Spicer. I didn't hit unmute in time for you to hear the first round of applause, so I appreciate you ladies for giving that to her again. We greatly appreciate your presentation. Does anybody have any questions for Dr. Spicer?
Yeah. In terms of things like a lot of people go to salons or whatever, or do their nails at home, are there any particular products or particular consideration?
So the question is, are there any particular products or concerns that people who have pedicures either at a salon or at home need to take into consideration with their foot care when they are diabetic?
I'll tell you. First of all, I never like to make sweeping generalizations when people ask me questions. So I'd like to say I'm not a proponent of getting your nails done at a nail salon if you have diabetes. The reason is because they are not regulated. And so with your medical condition, they are not treating you as though you have it. They use water products. Temperature can be an issue. The things that they put into it can be an issue. I'll tell you, one of the things I've been seeing lately is when they remove the polish and they soak people's nails or toenails with acetone, I'm actually seeing chemical burns on people's skin. So in my opinion, that's not a safe place for diabetic patients in general. Now, look, all of us are individuals physiologically, so that's just advice overall. But I do have some patients that have little to no comorbidities that get their nails done. I tell them everything has to be sterile. You need to make sure that whatever instruments they use on you, it's coming from a sterile package. I do not like them using anything that scrapes your skin. I think polishing is enough. Let them rub and massage your legs if you like to. I would recommend that you go to places that use plastic liners in the foot tubs, and always check the water with your fingers before you put your feet into the water, because sometimes it can be too hot. But I would just recommend, if you have diabetes, you should have a podiatrist, and you should have conversations about what is appropriate for you.
Thank you.
Yes, the only thing, and I religiously go to the podiatrist every year. When you go, they don't offer a preventive plan. They cut your toenails, some of them, and then whatever they are doing, and then it's like, yes, ma'am, thank you, ma'am, and you're out the door. It appears that you're about the prevention. So maybe perhaps those of us that are here don't fit into those that I don't want to be in that category. Because I know some people that have ulcers, people who have had their limbs amputated, and the whole 9 yards. And I sometimes, I'm sitting there thinking, how do you prevention? How do they get to that point? Is it an individual thing or what? Like I said, put doctors are like everything, every other clinician. Okay, this one could be good, this one could be terribly bad. But I just, like I said, it's amazing to me. And I chose a doctor. They didn't even have a doctor. This was at Northwestern. They finally got one, young guy. He had no clue. I didn't even figure, I'm like, did you even examine me or what?
I agree with you. Like, doctors are people too, right? So you get different people who have different focuses, I suppose. You know, one of the reasons, firstly, I'm from Michigan, moved to Chicago when I was 23 to go to podiatry school. And I think the reason I ended up practicing in the South suburban Chicago area is because I really have a heart for my people. And in my mind, I wanted to provide absolutely excellent service to my community in keeping them well and moving. Now, you know, they're doctors, they're podiatrists that come from different backgrounds, and again, have different focuses. So I do think it behooves everyone to make sure that, A, you're satisfied with who you have. I know some of us are limited by insurance coverage, but you can always go look and seek out someone until you find a good doctor that you have a good rapport with and that you are confident has your best interest at heart. But you're right, doctors are people too. My examination is not anything like what you articulated with the other doctor that you saw.
So it sounds like sometimes when you have to sometimes be your own advocate and seek out better resources, as you mentioned. Yes.
Thank you. And I used to do home care for about 8 years, so I am a nurse. And do you recommend, I'm going to talk about preventive methods, do you recommend all diabetics to wear like diabetic socks or any type of socks? Or should they wear regular socks? Or is diabetic socks one of your recommendations?
I feel that diabetic patients should wear pretty much any kind of sock they want to, provided it's not too tight and it's not 100% nylon. Now, there are people who have diabetes that have swelling. That's a different situation. Definitely diabetic socks. There are diabetic people who have vascular problems. So diabetes is a huge, it's a huge tribe with levels, if you will. So by and large, a sock that's not too tight and that breathes is what I advise, in addition to seeing a good podiatrist annually for more specific recommendations.
Thank you. I just like to add one thing. You are the first podiatrist that has talked about diabetic shoes. It took a patient to get my health insurance pays for them. And another patient said, you can get diabetic shoes. So I contacted the health insurance on my own. Contacted the health insurance. Oh yes, we pay for it. It's like a regular treatment. I paid 15% of whatever the cost was. Had someone to come out to the house, measure my feet, did all of this. Out of all of these years, I'm going like, oh my God, I was eligible for this. I mean, I'm a Nike fanatic, so I got I could probably buy stock in Nike, but there is a difference. And like I said, nobody ever said anything. I got a friend of mine who is a non-diabetic, had a friend who is that. She said, oh, don't you get this shit? No, I don't.
So Dr. Spicer definitely is a phenomenal doctor. And yes, she definitely advocates for everything that diabetics should have. Because she did mention last year and probably the year before about our diabetic shoes. But it also sounds like you need a different podiatrist. So we
Well, how lovely that Stonebridge has a podiatrist talk every year. Because knowledge is power. That's what we're all here for today. Knowledge is power. So tell a friend. And if you're not satisfied, I'm always available to see patients. I'm taking new patients, or I can recommend someone who has the same type of focus and understanding and treatment as I do.
Yeah. Well, actually, we have Dr. Spicer as our podiatrist every year because she operates in excellence. I am her patient. I went to her because I had problems with my two big toes. They turned dark. Sometimes the problem is people try to self-diagnose and say, oh, my shoes are too tight. It'll clear up. I didn't wait for that.
Yeah.
I went to Dr. Spicer and she gave me the care, the excellent care that I was looking for. And I have to say that health practice operates in excellence from the front of the house all the way to the back.
Yes.
Thank you. I appreciate that. Thank you.
Yes, Dr. Spicer is an amazing doctor. Does anybody have any other questions? No? Well, thank you again, Dr. Spicer, for joining us this year again. And yes, we definitely you all for joining us this afternoon. We greatly appreciate all of our speakers, Dr. Ansel Johnson, Dr. April Kennedy, Lisa Angel Smith, Dr. Terry Mason, and Dr. Stephanie Spicer. We hope that you all will join us for our upcoming programs and events. If you all signed up for the email list, you will receive a copy of our notification when this program is ready to launch. We do have our Take Charge of Your Health program starting in January. It is a 6-week program. We thank everyone for attending today. This was our 4th annual Diabetes Awareness Seminar. If you would like to follow us or stay connected with us, please follow us on Facebook, subscribe to our YouTube channel. This will be loaded onto our Thank you for joining us. If you would like to stay connected with us, please feel free to follow us on Facebook, subscribe to our YouTube channel. This seminar will be loaded onto our YouTube channel. You can also join our email list at shakoagroup@gmail.com or check our website for any of our upcoming programs at www.shcoi.org. That stands for Stonebridge Healthy Community Outreach Initiative. Thank you all and have a great day.